As you entered, you would have immediately noticed many changes in the format and the function that we've made this year, trying to incorporate some COVID safety features. I've already mentioned the new check-in and vendor procedures, but also, for the first time, this thing is being live streamed to a virtual audience via the Hope Conference website. Now, we would be amiss not to acknowledge the impact the pandemic has had on everyone, and especially those who've lost family members and friends during this hard time. I think we need to thank the doctors and the nurses and all the healthcare professionals who've worked so hard during this stressful time. Would you join me in doing that? We're thankful also that in March of 2020, the last Hope Conference that we had in person was just right before the world shut down for the pandemic. And last year we had an encouraging message of hope provided by our senior pastor here at First Baptist Church, Chip Stevens, on this website in lieu of the conference. But it's so good to be back in person, isn't it? We know cancer didn't shut down these past 2 years, and we've been so eager to get back in this room together and provide hope and encouragement to the cancer community through this Hope Conference. So let's pause right now. Where's Jim Spikes? Well, I tell you what, I'll pray. You see? Susan, may I just pray? Let's do that. They're probably getting nervous because they've given me a script for everything. Father, we do thank you so much that we can come to you. And Father, I thank you for the folks that have worked so hard to put this conference on. Father, I pray for every person on these panels that'll be speaking today. Father, I pray that you would give them the right words to say. Father, I thank you for the hope that we can have in Jesus Christ. Father, for the folks sitting in this room who are participants, God, I ask your blessings on each one of them. Father, in some you'll work wonderful physical miracles, but in all you can work through your miracle of hope. And Father, we just want to trust you with our whole lives. God, we're really reminded that you really do save the very best for those who leave the choices to you. So God, I pray for myself and I pray for these dear people that we would save the choices for you. We would let you make our choices. And so, Father, we make this prayer in the name of Jesus Christ, the Hope Giver. Amen. All right, at this time, I would like to thank our lead partners for this year's conference, the American Cancer Society, the American Lung Association in Mississippi, First Baptist Church of Jackson, Mississippi State Department of Health, the Mississippi Partnership for Comprehensive Cancer Control, otherwise known as MPC3C. Sounds like a British organization, like the Queen could call you in and do something through that group. Our sponsors are Compassus Hospice and Central Mississippi Planning and Development District. We would also like to acknowledge our planning committee at this time. We couldn't offer this conference without the work of these volunteers and representatives from the cancer community. They're listed in your program, and at this time, I'd like for them to stand. These folks work hard. Y'all stand up. A lot of them are already standing around the edge of the room. If you're around the edge of the room, you wave at us. Keep waving. Y'all keep clapping. Thank y'all. Thank you so much. And now we'd like to recognize the most important people at this conference, all the cancer survivors here. Regardless of when you were diagnosed, if you would please stand for us. Cancer survivors. Now, if you're a caregiver, if you're a caregiver, just wave, okay? But now I'm going to ask those folks who were diagnosed in the last year to please stand back up. If you were diagnosed in the last year, you please stand back up for us. And that stand is going to be made worth your while because we've got a present for you. You're considered a VIP at this meeting, a very important patient. And you just remain standing until you get your little prize there from Sam and his elves. Now at 10:30, we're going to take a short break from 10:30 to 10:45 after our first session. But please, don't forget, if you didn't cut your cell phone off a while ago, cut it off now. Thank you. It's time for our experts panel. We are highlighting our very popular experts panel this year, including some of our favorite experts that have participated in the past, as well as some new, very relevant experts participating for the first time. Our topic, surviving cancer in a pandemic. They'll also be sharing general information from their specialties. Let me introduce the members of our expert panel. Panelists, please raise your hand as your name is called. First, we have got Dr. Daniel Edney. Look at there. Down on the end, he is the Chief Medical Officer, Central Regional Health Officer at the Mississippi Department of Health. Before joining the Mississippi State Department of Health, Dr. Edney was in private practice in Vicksburg for more than 30 years. He received his MD from the University of Mississippi School of Medicine, residency at the University of Virginia Internal Medicine Program. Dr. Galen Marshall. Dr. Marshall is the Medical Director of the University of Mississippi Medical Center Clinical Trial Research Support Program at the Medical Center's Clinical Research and Trials Unit. He graduated from the University of Houston with a degree in biology from Texas A&M University with a degree in microbiology and immunology. He holds a PhD in microbiology and a medical degree from the University of Texas. Welcome, Dr. Marshall. All those degrees, I was thinking, ooh, that was a lot of time when he was in school. He could have been out in the yard doing something else. Next is Ron Mumbauer. Dr. Ron Mumbauer is a PhD graduate of Southwestern Baptist Theological Seminary in Fort Worth, Texas, in counseling and psychology. He's a licensed marriage and family therapist. Ron has been a pioneer in faith-based counseling, having served as the former congregational counseling pastor here at First Baptist Summit Counseling Ministries right across the street. Ron, welcome today. Now our next panelist is Dr. Q. And y'all can look at his name if you want to try to pronounce his first name. You know, Prince did not need a first. We got all these entertainers that didn't need a first name, didn't need a last name. You don't need a first name. I'm gonna call you Bud, okay? I want to say one thing personally about Dr. Q. Dr. Q, I've seen him at work in the hospital with patients, and what a great encourager he is to his patients. Dr. Q, thank you for being here. Let me read your stuff. Dr. Q practices at Jackson Oncology Associates, St. Dominic Cancer Center. He has a medical degree from Peking University Medical School, a PhD in biochemistry from Tulane University Medical School. He completed his internship in residency in internal medicine, UMMC, and a fellowship in hematology and oncology at Mayo Clinic. Pretty qualified man, aren't you? You are. Next, we've got Miss Jimmy Wells. Jimmy has had 35 years of experience in adult oncology nursing. She is presently an oncology survivorship navigator at St. Dominic's Hospital System, where she's responsible for survivorship care plan development, implementation, and maintenance. She received her Master of Science in Nursing from the University of Mississippi School of Nursing. So welcome. Next is Ms. Rachel Woods. Rachel Woods is currently a consulting dietitian with Nutritional Systems and works in the long-term care setting. She worked as an oncology dietitian for 5 years at the UMMC Cancer Center in Tupelo. And I'm sorry you saw me drinking a Coke. I will ask each expert to speak for up to 10 minutes on their specialty, as well as on the topic surviving cancer in a pandemic. Then, depending on our time, I'll direct a couple of pre-selected questions from the planning committee to each expert. Please help me welcome our experts panel. All right, where did we get to? Okay, it says we're going to start alphabetically and go in order of seating. So Dr. Edney, Dr. Marshall, Dr. Mumbauer, Dr. Q, Ms. Wells, and Ms. Woods. Let's hear from these folks today. Y'all, are you ready down there, Dr. Edney?
I am.
Good. They'll be glad to hear somebody who doesn't sound like me for a minute.
All right. Good morning. I'm glad to be with y'all. Dr. Dan Edney from Vicksburg, and I have the unique opportunity through COVID not only to treat patients inpatient and outpatient and in the nursing home with COVID, but also with my role at the Mississippi State Department of Health to have an opportunity to look at our entire population as we have fought a pandemic in Mississippi. And much better news this year than we had a year ago for you. I think you know that the pandemic is beginning to look like it's converting more to endemic status. The good news is it won't be killing as many people all at one time. It won't be putting people in the hospital as it has been for the last year at the same degree. But the challenge is it's not going away. And so we would, at the health department, encourage you to have hope that things are better. They are much, much better, but it is not over yet. And we are still dealing with a pandemic response, but slowly beginning to move to endemic recovery efforts. That'll be ongoing. Cases are markedly down. Deaths are still hanging far too many, but those are a lagging indicator, and they're already starting to come down, and we anticipate the deaths to continue to go down. We actually, in clinical practice, those of us who treat COVID are converting back to where we were 2 years ago, and that's from focusing on the entire population and pulling back more to an endemic status of focusing on those at higher risk, those who are immunocompromised, which is pertinent for today, and then also our folks who are older with multiple health issues. We went through a phase with a lot of younger deaths, mainly of the unvaccinated or partially vaccinated, but now we're starting to see the shift back towards more of those who are immunocompromised and are more vulnerable. But we do have many more tools than we had a year ago, much less 2 years ago. So first off, vaccinations do work, and if you're immunocompromised, they still are helpful. If you are immunocompromised based on your treating physician's opinion, then you qualify for 4 doses. You will have a 3-shot primary series instead of just a 2-shot primary series. So that the 3rd shot for the immunocompromised happens fairly quickly, and that is part of your regular dosing. It's not a booster shot. And then you do still qualify for a booster like everyone else, which would be a 4th shot. So the immunocompromised are the only ones who at present are recommended to get a 4-dose series. So if you have not had that fourth dose as an immunocompromised patient, we need to do so, or any of your loved ones would need to do so. It's very important to understand that the boosters are critically important right now. Boosters are making a very big difference with Omicron. The majority of hospitalizations and deaths that we are seeing are among the unvaccinated, but also among those who were fully vaccinated but opted not to get boosted at the 5-month mark, which is our current recommendation. And the percentage of deaths and hospitalizations in that group is too high. But those who are fully vaccinated, which now means complete your primary series and be boosted, are doing very well. You may still get Omicron, but it should not put you in the hospital or cause your death. If you are definitely immunocompromised, we have a very strong tool that you'll need to talk to your oncologist or your treating physician, and it's a combination monoclonal antibody therapy to prevent COVID. So these are for patients that we would expect would not mount a normal immune response to vaccination. And so in addition to vaccination, we're recommending Evusheld, Evusheld. And this is a monoclonal treatment. It's not to treat COVID, but it's to give you 6 months of protection. So it's almost like getting an artificial booster. And if you are immunocompromised, whether it's from cancer treatment or other treatments like rheumatoid arthritis or lupus, you and your physician would expect that you have not had an adequate vaccination response, you qualify for that. We do have better treatments for acute COVID. We have currently 2 monoclonal antibodies to treat COVID, and then we have 3 antivirals, which have been very, very helpful for patients who do have COVID. So if we have a cancer patient who contracts COVID, we are going to want to treat them acutely, not only try to prevent it with vaccination and Evusheld, but treat it acutely with our either monoclonals or our antiviral therapies. And they are widely available. In fact, they're being underutilized. They're not being used enough. But and that brings forth the important issue of testing. Testing is widely available. Most of you probably have tests at home. If you are getting sick, you need to test. And if you are getting sick, regardless of what your home test shows, if it's positive, you call your doctor. If it's negative, you still call your doctor and report your symptoms. Because if you do get COVID, we need to treat it and treat it promptly. And still, you've seen the CDC changing guidance for masking, but that does not apply to immunocompromised individuals. So it's our recommendation, if you are immunocompromised, that you continue masking indoors, like many of you are doing. Mississippi is mostly a low transmission state now, but we still have some hot spots depending on your county. Right now, central Mississippi is low transmission rate, but if you're immunocompromised, masking is still very effective, and we encourage you to continue to do that when you're meeting indoors with other groups. So a lot of reason for hope and encouragement. We still have some more work ahead. Common question is, what about a 4th dose for everybody else? And the answer is yes, probably at some point in the future, but not yet. But thank you for having me, and please stay safe.
So I'm not exactly a newbie to this conference. I've been privileged to be here before. I always love coming and just seeing faces. I want to make, and my background, Tom was talking about it, but my background, actually I was a basic scientist who went to medical school. And my PhD is in tumor immunology, my master's degree as well. So I have a long background in cancer. And what I got interested in as I moved through clinical training was modifying and manipulating the immune response. And so that's why clinically now I'm a clinical immunologist allergist at UMC. And I see patients with that as well, but we interact. I want to make one correction, and that Tom asked all the survivors, cancer survivors, to stand up, and you saw people from all over. The problem is that all of you that stayed sitting should have stood up, because we're all cancer survivors. Because of the very nature of cancer, we all get cancer. We got cancer as children, we got cancer as teenagers, we got cancer as young adults. But our immune system, as best we understand, was able to handle and take care of that, so we never knew it. It never became clinical. You say that to say that therefore one can argue that people that do develop clinical cancer have in some way a misfunction or a failure of their immune system to recognize and kill the cancer when it's still manageable. And that's a theory that's been around for a very long time, and there's continued evidence to begin to support that. And now there are therapies that are based upon that concept to try to reorient the immune system. Well, one of the things that I got into much earlier in my career and continue to work on regularly, we have 3 projects going on at UMC right now, one related to cancer, is we study how your mind affects your immune system. And it turns out things like severe psychological stress and anxiety and depression have really significant adverse effects on your immune system. And there are many studies that have been done that show, for example, that people with major depressive disorders have a higher rate of certain types of cancers. People that are under really high levels of stress, that are in very stressful jobs, have that. Well, I bring that up not only because it is something that is of great interest, been around for a long time and people are talking about it, but to offer you some good news about this. For example, there's a very important reason why we call this a hope conference. Because along with the word hope properly interpreted has a sense of expectation with it. So if you have real hope that you have a chance to live longer with your cancer, and that you may be able to, along with your providers, get to the point where no one can find your cancer anymore, that's not an unrealistic hope today like it might have been 10 years ago, 20 years ago, 50 years ago. We've got a long way to go, that we will never get all the answers that there are, and guess what? We all got a instruction manual when we were born. None of us have read it all the way through, and all of us have lined out certain things and scribbled it in, and every clinician around knows that. Medicine is called a practice for a good reason. We take a large amount of information and we make a series of educated guesses, but guess what? In this hope business, as it relates to cancer survivors, does it matter? The literature clearly says that optimistic people, the glass is half full, not half empty, people that have strong support system, the one that seems to be the greatest is the nuclear family, but just the very issue of the support you're getting in this room today has definable clinical benefits, and then a belief system. And the belief system, while it doesn't necessarily function on an organized religious tradition, it implies that we are here for a reason, and then there is a higher reason, if you will, for to explain things that happen to us. People that subscribe to this, their optimism, their support, and their belief system live longer with cancer. There is paper after paper after paper, study after study that has demonstrated that conclusively. So, what does that mean to us? Well, all of us, we have, those of us who, and I've not yet had cancer. I think if I live long enough, there's a good chance I'll get it. But I've not yet had cancer that made it to the clinical stage. I caught myself on purpose. What is it that once you deal with this, you're in remission? They can't find any sign of the cancer at all. Do you forget about it? I bet if we went around and asked people whose cancer is in remission, has been for a long time, do you ever think about it? There would be no one that said, no, I never think about it. It never occurs to me. It does stay there. But there's a difference between respecting something and fearing something. And so I would guess if I would tell you what one of the things that seem to be emerging in these various studies as they ask questions of survivors and so on, is that the one that survived the longest where their cancers are concerned seem to have an excellent respect, and the respect they would have good health behaviors. Because remember, you can eat terrible, have a slow-growing lymphoma, and die of a heart attack, as opposed to the lymphoma. Dead is dead. Once you're gone, it doesn't really matter. Did you die of a heart attack or did you die of the lymphoma itself? Now then you'll get the public health people that are wonderful. We can't do medicine without them. And they'll have epidemiologists and biostatisticians, and they'll do these associational studies, and they'll talk at us way, way up here, making us feel good, because they know a lot that we don't. And they'll tell you that there are associations. So does lymphoma, for example, make you more likely to die of a heart attack? They'll talk about those things. But the really important thing to understand is that even when they say these, again, none of us read the manual all the way through, and none of us follow it all the way through. Because you may have a genetic susceptibility is not an automatic death sentence. And because you don't have a known genetic susceptibility, and I emphasize that word, does not mean you get a free pass. Using reasonable and good health behaviors, starting right here in your mind and in your spirit, makes a lot of difference of not only the length of the life you live, but the quality of the life you live. With all the technology, and we'll hear more in this conference, we'll hear more about the technology of medicine, and it's wonderful. I'm old enough and have been in medicine long enough to see things that were just dreams when I first came out of training that are now routine. And that so the promise of the future for great inroads into cancer therapy is there, but it never changes the fact that all of us were born, and guess what? All of us are going to die. So the question is, what do you do in between, and then what happens after that? And we've had good discussions about that, and the idea is that those who have hope and an expectation for a future are those whose quality of life is better and their days and weeks and years on this planet are longer as well. And with that, I'll move it over to the real expert and tell you the why of all this, Ron Mumba.
Well, thank you. I am really excited about being on this panel. For years, I was where Tom was and mediated this thing. And to be here as a part of this illustrious group is quite an honor, and to be part of Cancer Masters all these years and the Hope Conference. So talking from a emotional, psychological, relational paradigm. I've never had cancer either. However, the closest I got to is 8 years ago. I was diagnosed with hyperparathyroidism, and the C word was used for the first time, and it was benign, and had surgery and all that kind of stuff. However, I have been a caregiver for my mother, who was diagnosed with cancer 17 years ago, or 25 years ago, and then my wife, her mother had pancreatic cancer. So we've worked with that process over the years. And of course, as a therapist, I have worked with families and caregivers. Dr. Marshall already made the comment about stress, and I'll come back to that. But I want to speak for a few minutes from the perspective for you caregivers. My first wife was diagnosed with multiple sclerosis and passed away over 17 years ago. So as a caregiver for her and dealing with being a paraplegic, and it was quite an interesting experience, and then eventually being a single parent after as a result of her death. You caregivers, if you don't take care of yourselves, you will die first. And I'm not saying, and I know that's pretty blunt, but we serve an incredible resource to those that are struggling with all that goes into cancer. And I mean, just the word sends us in orbit. I watched my mother when she was diagnosed and sitting there with the doctor when he was telling her what was going on, and I was just really a set of ears for her at that point. But being a caregiver and trying to think for two people in light of all of the other stressors. And so one of the things that I do in counseling and that I see my profession is coming alongside and working as a family a community to assist in this process, because it is an incredibly traumatic experience. And that term has become more prevalent in our culture, and especially from a psychological standpoint of trauma and what trauma does. And trauma basically is any life-altering situation, and that's going to be different for each of us. Dr. Edney kind of referred to this, and depending upon experiences from the past is depending upon how people deal with trauma. And I'll be talking later, but I want to encourage a book. If you've not read it, it's called The Body Keeps the Score. Anybody read this? It's an incredible story, an incredible book, and talking about the brain, mind, and body in the healing of trauma. And you can, whether it's abuse or things in the past, but then you put cancer into that and just what the body does. And again, going back to the immune system and all of that kind of stuff. Bessel van der Kolk, try saying that fast, is an incredible author, and I recommend that to you as a resource, caregiver as well as the survivors and the people dealing with cancer. Because what we internalize, and that's where the psychological and community, what we internalize comes back to bite us. And so by getting it out, whether it's mindfulness, whether it's yoga, whether it's exercise, whether it's eating, whether it's talking, praying, your religious preferences, get it out. The problem with cancer is it stays internal, and of course you've got doctors dealing with it and things like that, but to be able to communicate. Because when trauma hits, when life hits, as we've experienced with the pandemic, who would have ever thought that 2 years ago the world, not just the United States, but the world would shut down because of a virus? And yet it did. And so what it has created is what do we do with this thing? Ever sound familiar? What do we do with cancer? What do we do with whatever hits us? Divorce, death, whatever. What do we do with that? And we don't have a mindset because we've never been here before. We've learned a lot in 2 years in dealing with this pandemic. But what it's also done is it's isolated us. It's put us in little boxes. It's closed us off. We're living now in fear, anxiety. What my practice has skyrocketed since the pandemic happened, simply because people needed some type of an outlet to discuss and talk through their pain, their hurt, their anger, their frustration. Divorce is on the rise, alcoholism, all of these other medicants and ways of dealing with the pain. Oftentimes tells people, and it's coming to my office, they'll say, well, I'm just angry. I say, well, good. Good. Anger is an emotion. Anger is a secondary emotion, though. And usually the underlying emotions are fear, frustration, and hurt, whether it's stress, trauma, but fear. I don't know what I'm doing. I've never been here before. Frustration, just the overwhelmedness. Again, the caregivers, just the overwhelmedness of life. And then hurt. Why me? Why did this happen to me? And that's there's not a real an answer for that. We can diagnose it all we want to in a lot of different ways. It happens. Life happens. And unfortunately, we don't oftentimes have an opportunity. And what the pandemic did, it created a closure in the sense, I don't have any place to go. And we didn't know what to do. And so, again, the opportunities that we're having, and I thank the Lord for virtual, because it allowed us to do and stay in touch. But it was such a new way of dealing with it that we had never dealt with before, whether it was our church services, whether it's telehealth, all of these opportunities, but it kept us in community. Again, the beauty of community, and one of the things that's happened in our world is that we have lost safety and we've lost connectedness. And the pandemic aided in that process. And so finding community, whether it's church, whether it's family, and the nuclear family is having its own issues, but the importance and value of connectedness just like these little tables, you know, and that we are all in this together is so essential. So one of the things that I'm really seeing in the whole issue of counseling, psychology, therapy, whatever words you want to use, coaching, is this awareness. Awareness. And putting whatever is out there, whatever your fear, frustration, and hurt is, putting it out there and giving it a name and giving it a color, doing something with it. But being aware, I'm angry, I'm hurt, I'm confused, I'm disappointed. What our world has done is almost, we've gone to the TV screen and Dr. Phil or whoever, as opposed to community. And you don't have oftentimes the time with your doctors and physicians because they're all wrapped up in so many different things. But finding community, finding therapists, finding people that you can talk to or your pastor, a support group, you know, and those, whether it's virtual or in person, is one of the things that's really helpful in this process. And so, you know, the beauty of from my perspective, of knowing and being aware of what's going on inside you. You're doing, the doctors are taking care of you with the cancer, but oftentimes the emotional pain, and oftentimes the emotional pain is triggering something from the past. And when you can begin becoming aware of it, you become aware of the patterns and the habits and learning how to change that. And cancer can be an incredible change agent to help you moving forward. And again, to find hope in the midst of the storm. You look at the logo there on your program, you know, that lighthouse, and finding light in this process of finding hope amidst the storm. We're not going to change the storms. Stress is here to stay. But what are we going to do to find hope and find comfort and find a way through this process? And that's where we have community and connectedness. Thank you.
Over last 2 years, this pandemic, COVID-19, turned our life upside down. Society's upside down. We run for the covers, isolate ourselves. During this period of time, up to today, 970,000 Americans died of this virus. At the same time, 1.6 million Americans died of cancer. Before pandemic, after pandemic, this cancer will always be with us. It is a larger enemy. So while the fear for this virus going down, we have better weapons to eradicate this virus with vaccines, neutralizing antibodies, or even herd immunity. In my view, quickly it will turn into a history, a nightmare, like 100 years ago when we dealt with flu virus. When the nightmare go away, when we look at our cancer treatment landscape, especially the year before the pandemic showing up, we as cancer specialists were very exuberant. The statistics showed in 2018, 1 million Americans died of cancer. In 2019, 750,000 Americans died of cancer. All of a sudden, over a short period of time of 1 year, a quarter of Americans died of cancer. What was the answer? Attributing to two important tools, weapons. we had against the disease. I see some of my patients here. One example, chronic myeloid leukemia. When I was a resident, when you had this disease, I would tell you, your life expectancy from an outstanding fortune teller, no more than 3 years. Now, I will tell the patient, as your outstanding fortune teller, as long as you take 1 pill a day, you will not die from this leukemia. You will live forever until some other things, such as heart attack, stroke, and COVID, okay, make cancer doctors looking really good. The second breakthrough, the most important, is the immunotherapy. For years, oncologists, I never tell other people, but indirectly, it's in my mind, I always feel sorry if I prescribe chemotherapy. People lose their hair, nausea, vomiting, feeling sick. And give one disease class, stage 4 lung cancer. And according to standard textbook, 8 weeks without a therapy, with poisonous chemotherapy is about 8 months. All of a sudden, a few brilliant scientists in America and figured out what the immune system does in our body, just as Dr. Marshall discussed with us a few minutes ago. Since we were born from the man's name Adam, we had immune system inside. We have been for centuries looking for poisons from mushrooms, sea urchins, deep of the ocean, top of the mountain, all kinds of poison, toxic stuff to kill the cancer, but the best effective thing is inside. And we have something called immune system. This immune system therapy does not do anything to your cancer, does not touch your cancer whatsoever, just to go inside, mysteriously turn immune system on, make the T cells start to do the job, as on day 1 from Adam. Miracle happened. 25% stage 4 lung cancer, supposed to be living no more than a year, start to die from, heart attacks and don't die more from cancer. So over the last 2 years, our efforts to advance cancer treatment has been largely frozen because of this virus. Now we start to resume again our hopes, exuberance, and the new compounds will come out. And thank you so much for being here and give us encouragement. Our days just started. We are turning an incurable disease into a chronic disease, even curing. The things I never thought of during my training now is in reality, and the miracles just in our audience. Thank you.
Good morning. The first thing I want to say is that people always ask me, what is a navigator? What do you do? I am a nurse, but I think of it like your GPS system that you have on your phone or your car. I help you get to where you need to be. The thing that I do as a navigator is that I take all of the disciplines and all of the resources that are here, and I help you understand how that will work for you. The things that we've seen throughout the pandemic and how we attempted to help people is that, first of all, there was a lot of fear. There's already fear with the cancer, and then you added COVID onto it. And so what we did, and I do want to recognize that one of my coworkers and partners is here, Penny Pratt, who's also a navigator, and what we focused on for the last 2 years and even going forward is that we wanted to make sure you understood the importance of what was going on, and that we were basically interpreters for all of that wonderful information that you got from all the wonderful disciplines and all of that information where we think is common words. It's not common to think of monoclonal antibodies. Nobody even knows what that is. We take that and we try to interpret that for you. So over the last 2 years, what we have been navigating is that we continue to try to help patients once they're diagnosed understand exactly what that diagnosis meant. But even more important, one of the critical elements of cancer care, no matter what it is and no matter where you find it, is the consistency of you coming to get whatever the prescribed treatment is, or that you're able to get whatever that medicine is that was ordered, because we are very blessed that now we do have the option a lot of times of oral or getting pills for treatment. So what we do as navigators is that when you have those questions of, well, can I really go see Dr. Q? They got COVID. Should I really show up for that appointment? We got those phone calls, and the answer was absolutely yes. When you have problems getting medications or affording medications, most cancer teams here, especially in Jackson and Mississippi, we have all kinds of networks to try to facilitate you getting those medications, because they're not inexpensive. They're very expensive, and depending on what kind of payer sources you have. So as navigators, we see our jobs as helping you get through this process, doing the best you can with what you got. That's the other thing, is that we understand that each of you may be in a different place. All the diseases are different. Your background is different. Your family is different. Your needs may be different. But the thing that we try to do, because we're not actively involved in your physical care, we get to step back and give you perspective about all of the things that you're hearing. You hear stuff from nurses, you hear stuff from physicians, from the radiologists, from your oncologists, you hear it from your family, you hear it from the church, you hear stuff from everywhere. And sometimes it's hard to translate that information. It's hard to figure out exactly what should I do. What is the important factor here? What is the common denominator of what I need to be doing? So as a navigator throughout this COVID process, what we did and what we attempted to do is be that person to try to make sense of all that stuff. To give you the direction is, what's the first place? What are the priorities? There are some priorities when you are going through a cancer experience, and when you add COVID on top of that. We had a lot of patients that was like, well, I'm not going to come for my appointment. And I know as an oncologist and all the other medical providers, it drove them crazy, because this is the one time you really need to come. But everybody was so fearful. And fear is a powerful thing, and I do understand and appreciate fighting those things. And so we were instruments trying to navigate, trying to direct, and trying to refer. We're not experts in everything, a lot of times, and not at all, but we are experts in finding the people that are the right connection for you. I have no doubt that I'm not the right connection for everyone, but we are experts in finding that, connecting the dots for you. So what we do as navigators is that we want to make whatever that experience is, whatever that diagnosis is, our job is to make sure you have the information, you have the resources as much as we can help you gather them, and also we educate. We educate, because again, when you're sitting in the office, and again, I've been a nurse for a long time, and I remember I would sit and talk with patients for 20, 30, 40 minutes, and I just thought I had done a wonderful job. I was expert nurse. I had done all this stuff, and then when they come back for the next appointment, they say, nobody told me anything. You didn't hear it. They heard it, but anxiety is powerful. And you heard it, but it didn't sink in. And so that's why we encourage you going through a cancer experience. Bring somebody with you. Bring somebody with you, because you hear maybe 2 words and that other person will hear 2 words, and when you put it all together, you might get about a third of what was said. So we try to help you understand that and to navigate that, because there's a lot of information. It's amazing to me when we get phone calls and they say, well, so-and-so told me that I don't need to do this. I was like, well, no, I think you probably misheard that. That's not so. You know, well, they told me not to go anywhere, so I'm not going for my doctor's appointment. No, that's not what that meant. So what we do is try to help that. The other thing that we have done, and what I'm finding now, is that prior to the pandemic, or basically prior to the pandemic, I focused and thought navigation was only about a cancer diagnosis, and that is a primary role that we have. But I'm also finding that it is also about helping people to not visit people like me in the hospital. Navigation starts before cancer diagnosis as well. It is important. There are lots of tragedies that happen with COVID, but one of the other things is our lack of screenings. People stopped going to get their screenings. A lot of times the screenings were closed. It was difficult for patients that were undergoing treatment at times to even get their CT scans and get their PET scans, scheduling and getting people there, getting transportation. All of these things became a real problem, and we are in a situation now where thankfully we're catching up, but we went through a period of time. Do y'all remember that breast imaging was not open? You could not get your mammograms. It was an issue. People were not getting colonoscopies. They were not getting colonoscopies. Depending on what kind of surgery you needed, you were not getting surgeries. People were not getting ports placed because that was not a life-threatening issue. So we had lots of things that we had to help people navigate through. We had to help them understand and try to find resources to get around that. So what I want to say is that as a nurse, as a caregiver, as someone that not only professionally have taken care of cancer patients for a lot of years, since my semi-retirement, I retired, but it didn't take. Since my semi-retirement, I have also taken care of a lot of personal family members and friends that I've walked at. So I've become the caregiver that is not the skilled person starting the IV. So I would say, as a caregiver, you need navigation too. I love the fact that you guys spoke about the fact that caregivers, you have to take care of yourselves. It is critically important that when we call as a navigator, and I call, a lot of times I'm talking to a family member, because you're helping the patient with those appointments, keeping up with what those medicines, keeping up with when they're supposed to be where, helping them with those side effect managements. But the last thing is, when did you last eat? Did you keep your appointment? Have you had your screening? We know now that with a lot of cancers that they pass along family lines. What is your family history? If you are taking care of a sister that had breast cancer, when did you have your mammogram? Have you talked to your physician about the fact that you have a family history of whatever it may be? Have you talked to your children about what your family history is? Because that has significance on what actions or what things they need to be doing going forward. So as a navigator, what we do is whatever people ask us to do. That's the real answer. Whatever they need us to do, we wear many hats. We do lots of things. We teach, we counsel, we educate, we do navigate. We help you find the way. We are that lighthouse sometimes. We will stand there and we will yeah, you need to go see the doctor. But you know what? I think this is a time to talk to the dietitian. I think this is a time that we need to talk to the social worker. Yeah, we need to talk about those genetics. We need spiritual hope. I think that is the greatest gift that we can give to anybody, is to share who we are and what we are, making sure that as best we can. Now, do we have the answers? Do we have ultimate control? Absolutely not. Does everyone have good outcomes? Absolutely not. But whatever the outcome is, my job is to help you walk that walk, whatever your journey is, whatever the pathway the Lord has for you to take, we will walk it with you. We will go with you, we will help you, and we will help you get to whatever that ending is. And we would love for it to be that you come back to Hope Conference every year, but if it's not, we will help you with that as well. So I just want to encourage everyone, as a navigator, as a caregiver, as a nurse, continue to be mindful of your physical health, be mindful of your mental health, and also be mindful of your spiritual health, because it all works together. Thank you.
So when you get the last name Wood, you get the last. Save the best for last, right? No, I'm Rachel Wood. I actually live in Tupelo, so on my drive down this morning, I was thinking about this amazing conference, and thank y'all for including me, as nutrition is a very important part in your journey, whether you are a caregiver or a survivor or a newly diagnosed, or you're currently going through chemo or radiation surgery. I used to always tell my patients the Sonic drinks, you know, the Sonic slushes. Everybody loves a good Sonic slush. Cancer treatment's like a Sonic slush. It can be 5,000 different flavors. You can have surgery and then you're done. You can have surgery and chemo and then you're done, you know, or you may go into remission, or you may have the whole gamut, like some of my head and neck patients used to have. So, but nutrition is still important in every part of that treatment. I used to end up actually talking to my caregivers more than I would the patients, because a lot of times if we're going through chemo, you usually have the nausea, vomiting. You don't really have an appetite. That's usually the big one. I have no appetite, Miss Rachel. I have no appetite. What do I need to do? And the patient's sitting there just saying, I don't want to eat. I don't want to eat. I know I was a caregiver for my father who lost his life to cancer, but his last week on earth, he drank Mountain Dew. And that is perfectly fine with me, you know. And so that's what he enjoyed, and that's what he lived off of for those last week. So we went through a lot of Mountain Dew. But, you know, I actually would spend a lot of time with caregivers kind of outside the room, because what I found was when they're in there in their visit together, it's like, you need to eat. You need to eat. You got to eat more. We need to eat some more. You need to eat. How many of you are shaking your heads like, yeah, I've heard that before, okay? Some tips and pointers. I found myself actually giving more little tips and pointers to the caregivers, because they're usually the ones that would prepare the meals for the patients, or they would be the ones buying the groceries. They would be the one preparing the meals, giving the meals. But what do we know about food? Actually, all of y'all probably said, uh-oh, the dietitian's here. I had a Coke this morning. Okay, it's okay. We're all human. I had eggs and bacon this morning. It's okay. You know, but food is social, is it not? Do we not tend to eat more when there's kind of like a social setting with food? So I always encourage my caregivers to, even though you may not be hungry, have something there to set that setting of, we're going to sit down and have a meal, or we're going to sit on the front porch swing on a beautiful day and have a snack. Because when there is no appetite, sometimes this is overwhelming. Okay, something as small as this is overwhelming. So we don't want to bring in the big portions. We want to go small portions. So almost back to toddler size of a couple of peanut butter and crackers, a half of a sandwich, a very small milkshake, very small portions. Setting a timer. I brought my phone up here, not to look at it, but to show you. Set a timer for about every 2 hours, and then encourage a snack or something small to eat. When that timer goes off, have things readily available in your refrigerator that it's a grab and go, because as you know, sometimes if it hits you of, oh, I'm hungry, you've got to capitalize on that moment of that hunger to get as much nutrition in as possible. Do we prefer good, wholesome, quality foods? Absolutely. You know, your fruits, your vegetables, your small portions. Sometimes that's the small window we get, and then it's back to, I just don't feel like eating. I'm not hungry. And it may be 1 or 2 days that you know they haven't eaten. So maximize those windows. Plan out an opportunity for them to have an urge to eat. Sometimes getting their favorite things. You know, sometimes we run all over town like, oh, I really could eat a Sonic cheeseburger right now. You know what I mean? What do? We get in the car and we go, and we bring it back. And then sometimes by the time we get it back, I'm just not really hungry anymore. Some other fun tips are, I know how many of you have heard of the Ensure and the Glucerna and the Boost, all this kind of stuff. A lot of times my patients were like, I'm so sick of those things. I'm sick of them. Okay, and yes, they have a different taste than a good old homemade milkshake. But can we sneak that in a little bit? Absolutely. I used to always take an Ensure and about 4 or 5 scoops of ice cream and some whole milk and a little protein powder and make my own milkshakes for my patients and put them in Sonic cups. Okay? Put them in little Sonic cups. Get your local Sonic or McDonald's, because mind over matter, right? It's in the mind. If they see an Ensure bottle, not gonna drink it. But if they see a Sonic cup that's a homemade milkshake, guess what? They're more apt to drink it, okay? So just little tips and pointers of that can go a long way. If you are, back to those that are, like he said, we're all survivors, but if you haven't clinically had a diagnosis of cancer, nutrition is just as important for you in the prevention, okay, and helping of prevention and building that immune system. Lots of fruits and vegetables. I always tell people, stay to the outside of the grocery store. When you get that shopping cart, go to the outside. That's where you're going to have your fresh vegetables and fruit and your dairy, your lean meats. Because once you get to the inside of the grocery store, it's instant, quick, meal in a minute, chopped full of processed foods and a lot of big words that we can't pronounce, okay? If you can't pronounce the first 5 ingredients on the back of the box, you might want to put it back on the shelf, okay? So stay to the outside of the grocery store. Get your fresh and frozen fruits and vegetables, okay? I know fresh fruits are expensive. I know I looked into the store the other day and it was $5 for a pint of strawberries, and they're probably going to go bad in 3 days, okay? So frozen is your next best option, okay? For those that are currently going through treatment, like I said, some of those tips and pointers, especially with if chemo is affecting your appetite or your intake, but also be mindful of what you're putting in your body. Find a dietitian. Don't search the internet, okay? I had one patient that special ordered some wine that was proven to cure cancer from Virginia, okay? We lived in Tupelo, Mississippi, and he had a case on the way. So find a dietitian. Nutrition is such an important role, and it's such an important part of the team, your cancer team, to find a dietitian. If you don't have a dietitian in your cancer oncology center, ask your doctor to find one for you, okay? Or you can Google, I think the Department of Health, you can actually look for dietitians in your area. And it was amazing to me, and I hope the number has changed. Several years ago, when I was working in the cancer center, I was only one of only 5 dietitians in the state that had their specialty in oncology nutrition. So I'm hoping and praying that number has doubled or tripled by now, because it is such a vital part of the team as a nutrition and dietitian. So find those, okay, because they can give you those little tips and pointers along the way to help boost appetite, to help improve or optimize your intake throughout the treatment. And then post-treatment, okay, say you're in remission, you want to make sure that you continue that healthy diet of lots of fruits, lots of vegetables, lean proteins, those type things, and they can help you develop a plan. I'll say that just to make sure, yes, Google is out there, yes, Dr. Oz is out there, all these people are out there with all these fun things, but find your local dietitian. He or she will be readily available to you to give you those tips and pointers. And also, like I said, kind of mentioned my father in the beginning, when it gets to the point, and like you said, there's some journeys don't end well, and don't worry, throw everything. I had to throw the clinical hat off and become the daughter and realize that, what? It's okay. If he wants a honey bun and a Mountain Dew, that's what he's going to get, okay? It's not what I would preach, but guess what? If that's what he'll eat, then that's what I'll take, okay? And that's what I'll give. So don't think that just because nutrition is, I got to watch what I eat, I need to watch. At some points, if that's what they'll eat, let them eat, okay? But like I said, just to kind of close, I do encourage find a dietitian or a licensed nutritionist that can help you in your journey along the way, before, during, and after. And thanks again for having me. All right.
Boy, didn't they do a good job? I think they deserve a standing ovation, and I think your legs deserve it too. We're going to ask these folks some questions now. We're going to have one question per expert. You know what? Dr. Wells, you are the best smiler I know.
You're sweet. I'm not a doctor, but thank you.
Well, yeah, you're the doctor of smiles.
Oh, okay. I'll take that.
It's conferred on you today. Y'all all agree? Me too. All right, we're going to ask one question per expert. We're going to start with Dr. Edney down there, and we'll just kind of go until we've reached the end of our time. The first question that I'm going to ask Dr. Edney, it's hard not to put a little commentary on here about the Jackson City Council, but anyway, how and when will cancer patients be able to access medical cannabis under the recently approved legislation that the State Department of Health will be regulating when that treatment is deemed appropriate by their doctor?
Well, that is, other than COVID, the health department's second most fun topic to deal with. And you probably know that the Department of Health was chosen by the legislature to get the program up and going. And so we're feverishly working through that. We have 120 days from the time the governor signed the statute into law to have all the rules and regulations in place and begin the ability to license patients and to license physicians and other providers to be able to certify patients to qualify. And then after that, there has to be at least one growing cycle. So there won't be any importation of cannabis from other states. It has to be grown in Mississippi according to the rules and regs. So we're looking at probably another 6 to 8 months for those who are really prepared to start now before the first crop is in the dispensaries. It won't be next week, so please don't call.
All right, sir. Dr. Marshall, who, by the way, if you're looking for a good Sunday school teacher, do you still teach Sunday school, Dr. Marshall? I bet I know he is a good one. Over the years we've held the Hope Conference, we've heard the terms precision medicine, gene therapy, immunotherapies, and others used in regard to what the future holds. These ideas are becoming more mainstream and even being discussed in the best-selling book, Life Force. How close are we to accessing these types of treatments for those with cancer today, and will they be accepted and promoted by a healthcare system that often resists new breakthroughs? That might be the longest question in the history of the universe.
Which I did not write, by the way, just so you know. It's a very complex question, but let me see if I can break it down and make it a little bit more useful. So probably in every physician's knowledge, our historical roots go back to the days of Hippocrates, who was a great Greek philosopher and physician. And so we, in fact, at the end of our medical school, we stand up and take what's called the Hippocratic Oath, that we will do the best that we can do to care for our patients. Well, that was based on early observation. There were no blood tests in those days. There were no CT scanners. There was nothing. And as we progressed through the centuries, pretty much what was done was based upon the experience of the provider. So by definition, the physician with gray hair was a better doctor than the physician who just came out of medical school. Not always true, but that was the assumption. Then they begin to understand we transition to a time called evidence-based medicine. And the idea is now, instead of me treating you based on how I thought you would be, even though that was a level of evidence, we wanted to see, what if there were 100 people like you, if there were 1,000 people like you, what would be the variability? And from that, they developed research that were called clinical trials. And a clinical trial basically says that, in fact, the earliest clinical trial that I know of is found in the book of Daniel. And if you remember that Daniel was captured, and he was be brought up in a royal household, and King Nebuchadnezzar had all of these foods that he wanted all of his junior people to eat. But those foods violated the principles of spirituality that Daniel and his colleagues had, and he persuaded the caretaker of them to allow him to continue to eat what they had brought from Israel, and the rest of them would eat what the king wanted them to, and then look at them and see how they did. And sure enough, Daniel and his colleagues were doing great, and the rest of them not so much. Too much Mountain Dew, I think. But I love Mountain Dew, so I can't say that. So the idea of a clinical trial is put there. Well, and then, everybody wants to be in the treatment, but yet some people, you have to compare it to it. So it's called a placebo. And then we also know of something called expectancy. If you're getting the therapy, just the very fact that we're giving you therapy will make you better. They've got a fancy name for it and so on, but that's the fact. So it becomes blinded. If I know you're getting the therapy and I know you're not, I'm going to have different expectations. Well, this should work because you're getting the medicine, and it maybe not work because you're not. So it's blinded to the researcher, and it's blinded to the participant, the patient participant. So randomized, double-blind, placebo-controlled trials was the level of evidence. Now then, as our technology has developed, that was still assuming, well, you get the same therapy, you get the same therapy, you get the same therapy, and you get the same therapy. And if you have a big enough number of individuals, you begin to get an idea of who it works in and who it doesn't. That doesn't help very much when Dr. Q is faced with you're coming in to see him, and he's got to decide, what therapy do I use? There's some standards that he uses, but what he can do now that he couldn't do just a few years ago is that there's certain tests that can be done that relates to the genetic part of your body that's called the genome, and he can get results of that will dictate what sort of therapy he may or may not offer you, because you have this genetic marker, you'd be more likely to respond to this medicine than the other. But even that, we know, is influenced by the environment you keep. And one of them, again, just to say this briefly and not beat it up too bad, can be your psychological environment, psychological and spiritual environment, your attitudes. But it can also be, if you've got lung cancer, back in the day when I was a medicine resident many years ago, somebody who came in as stage 4 lung cancer and still smoking, we said, don't worry about it. Go ahead and smoke because you're going to be dead in a few months anyway. Why steal that last little pressure? Well, it's very different now. It's very different now because survival is encouraging them to quit all along the way still translates to differences. And if you can now further influence their environment, that has an impact on how that medicine responds in that genetic individual. And then lifestyle choices fit that as well. And that's the definition of precision medicine. Therapy that's based upon the genome, when it's known, influenced by the environment and personal life choices. Obesity, type of diet, mindset, all these things. That's an exciting new area of medicine, and oncology, of all the specialties in medicine, is probably the furthest developed by far. The oncologists were visionaries that saw this 35, 40 years ago. The federal government, not just ours, but others around the world, put money into it because using the C word, as Ron said earlier, it strikes fear in everybody's heart. And it strikes a certain urgency. And candidly, that's okay. To be urgent about it and to be expedient about it, I prefer the word expedient to urgent, but the idea is that I'm not going to sit around and not do anything about it. I want to do something that comes out and is valuable. Where are we going? Well, not only in oncology. Remember we talked about this earlier. You can live with cancer. You can die with cancer. You're 87 years old and you have a heart attack, and you've had cancer for 20 years, but it's stayed in control. That's the definition of a chronic disease. Or you can die of cancer. And aside from the cures that we all want to talk about, I'm cured, there's no sign of disease whatsoever, is that I'm okay living with my cancer if I get to live X period of time more in the future and I die of some other reason. So I live with cancer, I live with diabetes, I live with heart disease, I live with, I lost a limb in a trauma accident, so I live as an amputee. That is where we're going in these areas, and I think where the next stage that you're seeing, and you're already seeing, and will continue to see more, are therapies because they're more focused and more responsive that will allow people to live longer with cancer and will continue to increase the number that will get well. Since 2000, 25% less mortality for cancer now than in the United States. And the goal now that's been set by President Biden and the NCI is in the next 25 years, I'm sorry, I get these numbers mixed up. The next 25 years, so by 2050, is to lower the death rate another 50%. And they have a pathway out for that. They have a realistic pathway set out for that based upon the technology and based upon the resources that are being committed to be able to do that. If they sustain that, I think they'll beat that number. I think they'll beat it very rapidly time-wise. And I think that you'll see people that now the clinician has to say to you, we've really done all we can do, that a few years from now, won't be that way at all. It'll be far more routine. I remember when AML was untreatable. I remember because I'm older than you are, and I remember in residency seeing people with AML that there was really no therapy for. And these people were dead in a matter of months. And as he said earlier, it's becoming a chronic disease. The miracles that we're seeing with the technology that's being developed, just don't forget the humanity that has to be mixed in with that technology. And I think that's the admixture that is of greatest danger, and without sending too much false praise, if we've got people like Dr. Q taking care of us, I think we're going to be okay.
I think I'm going to commit the unpardonable sin and get out of order. Dr. Q, it looked like you were about to bust to say something.
I think Joe Biden's ambition is too conservative. Our numbers should be better in my view, and a few more good drugs is going to ready to come out really soon.
Thank you.
Yeah.
All right, Dr. Mumbauer, as a person deals with cancer, tell us about some of the coping skills that we need as we deal with cancer, and give us some suggestions on when it's time to seek professional help with our coping skills.
That's an interesting word, coping, because there's approximately 100 people in this room, and each of you have a different way of coping. Who's wrong? Now, there's some coping mechanisms that are not healthy. We could go into all of those, addictions and things like that, but it's a way of medicating to the pain. One of the best ways of coping is awareness. I used that earlier. Being aware of the pain, the wound, the trauma, whatever word you want to give it, the discomfort, the discouragement, again, awareness of what does this remind me of? What is this? So some of the coping mechanisms we deal with is just anger. I've talked about that. But so practically is break it down. Anger is a secondary emotion, but it's a very powerful emotion, but it can be very damaging, especially if you're an internal anger and you just push it all down. Fight, flight, or freeze. Fighting, you can, attack the doctor, you can attack the dog, you can attack the neighbor because they don't have the cancer or the illness. But to be able to be aware of it, no, I am scared to death. I don't have a clue what to do here. Okay, so if I don't know what to do, where do I go? So finding the resources, and again, things like this Hope Conference, knowing where to go and finding resources, that's a practical strategy. Ask for help. Guys, we're the worst at it. Whether you're a caregiver or, a patient. Because that thing called testosterone inside us as men, we're going to make this thing work. We can figure this out. I'll get her done. You ladies, you'll cry. You get it out. And that's a practical strategy. Having a friend just to talk. One of the things when Karen was real sick, I just was appreciative of just a friend that would just let me vent. Now, I'm the professional. I'm supposed to know all this, but I never had a wife that was that sick and dealing with all of that. But I just need somebody just to listen. We've been given 2 ears and 1 mouth. So again, as caregivers, and I think finding people that are good listeners. And there are some people out there that are just terrible listeners. Men, we don't listen well. We want to, because we are geared to fixing. Listening is a fixing. I know that's not a good grammar, but listening is good. You don't have to solve it. When we're dealing with issues and problems, and especially a person is not something to be fixed, but someone to be understood. And that doesn't mean you have to agree, and especially when it comes to issues like what we're talking about. So practically, listen. I said earlier, get it out, whether it's a walk around the block, taking the stairs, if you can. Eating is the nutrition, boy, that has been proven so effectively. Eating effectively. Your spiritual practices, we keep coming back to that, but that has been proven effective. And whether it's reading a devotion book, whether it's prayer, whether it's your rosary, whatever it is your practice is, use it. Because again, it's that going to the higher power. My higher power is Jesus Christ, and it's like, and being able to realize that there is hope there. But finding that and getting it out and going someplace with it as opposed to just internalizing and keeping it inside. Going back to the immunity system, it is unhealthy to keep all of that inside. Get it out.
Thank you, sir. All right, Dr. Q, who ought to be called Dr. GQ. Look at him. Look at him. When do you recommend a patient who is currently undergoing cancer treatments receive COVID vaccinations? How much more susceptible are cancer patients currently under treatment to getting COVID?
It is a very complex question. Depending on the age, the type of cancer therapy you had, even for healthy people without any cancer or chemo, when you get a vaccination afterwards, you're still susceptible for COVID infection. However, the severity and duration of the disease can be much shortened, and the mortality has much improved. In my view, vaccination is better than no vaccination. More vaccination is better than less vaccination. Neutralizing protective antibody we are giving to our patient Evishield for cancer patient is better than no neutralizing antibody. Whatever, it works. Get it.
Thank you, sir. All right, Jimmy Wells, how can a cancer patient become their own advocate for receiving the best care available, and how can they communicate their needs to their nurses and doctors? What works and what doesn't? If they got you, they really don't need to become their own advocate, do they?
Well, yeah, they do. The one thing is be almost like a squirrel and gather your nuts. You know how squirrels, they gather up all of these little nuggets, they gather up all these things. So learn. You can learn from everybody and everything. And know that be a good note taker. Be a good note taker, because all this stuff, you're not going to remember it. So marshal yourself, arm yourself, learn as much as you can, but be careful of your sources. Be careful of your sources. Your oncologists, the people that are being recommended to you. Google, God bless Google. But it is not your caretaker. It should not be the place where you rely upon, and God help you with social media. They have their place. But the best thing that you can do to be your own advocate is to learn, to study, and to surround yourself with people that are going to encourage you, people that are going to help you learn, to help you carry some of this knowledge. Now, I have to say this. Sometimes I go to church groups and I speak to church groups, and it just always boggles my mind how when people will come to you and tell you their horror stories. My Uncle Joe 15 years ago, yada, 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 yada. And the thing that I will tell you is that to navigate this, it's okay to tell people no. It is okay to say, you know, I really don't want to talk about that, or I really don't want to hear that. If people are bringing you something that is not nourishing you, that is not enhancing you and helping you in your journey, it's okay to say no. We don't have, you know, we're good Southern folks and we're real polite, but you can politely say no, thank you. And you can politely say, I really don't want to discuss that, and I'm sorry for what happened, but I really don't need to hear it. That is okay. The other thing is that not only to educate yourself, to gather those nuggets, gather those nuts, or whatever it is that's going to sustain you, and then once you reach your capacity, surround yourself again with those people, those caregivers, those people that are going to nurture you, those people that are going to help you and support you. And it has nothing to do with education. It actually sometimes doesn't have anything to do with who lives in the house with you. It is not about a blood thing, it's a heart thing. So don't rule people out. A lot of times as navigators, we talk to neighbors. The neighbor is the one that gets them to the appointment. The neighbor is the one that goes to the grocery store. So don't limit yourself. Create your village. I have a friend that is going through actually seeing Dr. Q, is newly diagnosed, took care of her husband, and she had issues, but she ignored her issues while she was taking care of her husband. And the one thing that I've encouraged her, even with her husband and with her, you need to build your village. Build your village with the things that sustain you, that support you, and get you what you need as you learn to navigate. Because I will go so far with you. Dr. Q can only go so far with you, but this is a thing that you have to manage. I did a talk one time about having cancer is like a 3-ring circus, but you got to have a ringmaster. You got to be your own ringmaster, and you learn that by learning the skills, one day at a time. Thank you.
I keep hearing one thing from 3 folks, and probably the others would agree too. Alexa ain't our doctor.
It will send you to the doctor.
It'll send you to the doctor. It'll send you to Dr. Mumbauer down there. Run you slap crazy. All right. You already told us not to order wine from Virginia that will cure cancer, so off the internet. But Rachel, when and how should a cancer patient consult a dietitian? And are those costs covered by insurance?
The answer to me is immediately. Usually when, or hopefully in the cancer center or the oncology clinic that you visit, there is a dietitian in place. Depending on the type of cancer, the type of treatment that you'll be going through, sometimes leads to varying nutrition information. For example, anyone with head and neck cancer treatments is going to be more nutrition involved. Some of those with less invasive treatments are going to be helpful but less involved as far as the course of treatment. The other one was the cost. Oh, cost. I know in our clinic, I was always covered. I mean, I was a service that was provided. I don't know as far as other clinics or other carriers or things like that, how that works. I do know there are private dietitians that insurances do cover with a referral from the doctor or the oncologist. But biggest thing is just immediately, just go ahead, and if you hear the word cancer and get that diagnosed, go ahead and ask for the dietitian or nutritionist or a referral to one if there's not one in-house.
Let me ask you a follow-up question
Okay.
on that. Vitamins, supplements, these things that so many people seek out, and nutritional supplements. Where and how can patients get reliable information on those things?
I would say definitely, it's funny you say that because a lot of times I would ask, what medicines are you taking? We would do a medicine review, and then a lot of times, and some of these doctors may know, a lot of patients don't consider vitamins and minerals and supplements as medicines. However, they can interact with a lot of these medicines. And so next thing you know, they're on like horsetail thistle and this and that, and you're like, whoa, you didn't tell me any of that. So they may actually have a list of these supplements of things that they've researched on the internet that cures cancer. But usually, I mean, just the dietitian or even the doctor is the perfect referral person for that, as far as just, hey, give a complete list. If you list your medicines, also list any vitamin, supplement, mineral, anything else that you're taking that you may not consider as a medicine. List it, because we need to know what you're putting in your body as you're going through these treatments. I usually always recommend with the doctor, if they're not on a multivitamin, to take a multivitamin, especially if an intake is diminished through either nausea, vomiting, diarrhea, anything like that as a result of chemotherapy. But just in general, as general practice, I usually always recommend a multivitamin to anybody. So.
Tom, let me add to that. If I could add to that, I see patients that come in that have drug sensitivities, and doctors will send patients to me because they've developed a drug allergy. This is so relevant because one of the things I saw a patient recently, is a gentleman, it wasn't for cancer therapy, but I've seen him in that situation as well, who had been taking a statin to keep his cholesterol down because he had had a transient ischemic attack and he was being treated well. He'd been on this medicine for 6 years with no problem. And then he started a supplement, an over-the-counter supplement for actually general health reasons, not even specifically to treat anything, but he was getting older and he wanted to be healthier and so on. And it wasn't that he didn't tell his doctor, it was that the doctor didn't ask. And the end result was that this gentleman was sent to me because now he had developed so much weakness that they thought he might have ALS or multiple sclerosis. He had trouble getting up out of a chair. He couldn't comb his hair anymore. Well, it turns out that this statin, there is a well-known side effect of this statin. It can create muscle weakness in a tiny fraction of individuals. So what was determined that was, in fact, that when he added that supplement, his body changed how it was handling that statin, and this weakness, where they were talking about doing spine surgery, they were talking about end-of-life planning, because if he had MS, he was going to die in a shorter period of time. They stopped the supplement, they stopped the statin. In 6 weeks, he was back to normal. They were able to restart the statin without now the supplement, and he continues to do well as well. So just to support what she just said, absolutely list it, and if you're coming in to see your doctor for the first time, it's always good to have your list of prescriptions. Doctors like that. Have your list of other things that you put in your mouth for any kind of a health reason. Have it on that list as well. It can make a difference.
Yes, sir, Dr. Hugh.
Yeah, to answer the question, vitamin intake and association with cancers. As Dr. Marshall mentioned to us, starting from Daniel to modern medicine, the highest quality of evidence coming from phase 3 randomized study. We had a very strong ambition for years that those antioxidants may reduce the risk of cancers. The largest study started from MD Anderson, let the patient consume those antioxidants, vitamin A, C, all kinds, E combination, to prevent oral cancers and lung cancer. Surprisingly, the end result is instead of seeing decrease of those cancers, we see triple of those cancer incidences. Then we try to use folic acid and other type of antioxidant to decrease the lung cancer. Again, the opposite effect was seen. We see the fueling, the burning, the higher risk of lung cancers and even cardiovascular diseases. So the question is, what we have been doing, we're doing wrong? I mean, the end of the day is that somebody hypothesized that vitamins are nutrient for cells. Cancer are cells. Their cells have better ability to grab more essential nutrients. If you feed this patient with those stuff, what type of cells get those? Therefore, based on, I mean, of course, you can finger point at those clinical interventional study from Houston and Mayo Clinic. They're using maybe mega dosage, which turn out to be a carcinogens instead of cancer preventive medicine. So you can argue, maybe reduce the dosage, you can save some cancers. But the point is, if a higher dose is poison, the lower dose would be the opposite, or less carcinogenic. My position of this, this is representing myself, is based on clinical phase 3 research. I do not recommend my folks to consume or unnecessarily buy those things because, number one, consuming money. Number two, there's no evidence to support. Number three, may do you harm.
Wow. Well, I try to get all my antioxidants through dark chocolate. And I'm taking massive doses.
From Sonic, right?
Or Sonic, yeah. All right, Dr. Edney.
More on medical marijuana?
What lessons learned through the COVID pandemic in how to inform the public concerning health threats and encouraging them to take appropriate actions? Vaccines, masks, that kind of thing. What's worked and what hasn't?
Well, and that's been a great challenge for us. As a physician treating COVID patients, we went a year with no tools, with just trying to support people and keep them alive and get them through it. And we were anxiously awaiting vaccination and knew that we had to have it to get through the pandemic. And lo and behold, the Lord gives us exactly what we need just in time. And only about half of the population decides to take advantage of it. As a clinician and a public health physician, that's been extremely frustrating to have it's like having the cure for cancer and patients not wanting it. And certainly to have the ability as a population, as Dr. Q mentioned, with herd immunity, an important way of protecting the immunocompromised that may not respond well to vaccination is for everyone around them to have immunity to protect those who are not able to be vaccinated or have a good response. And for us, Google's not so much been the enemy as much as Facebook. And so we have struggled for a year, expending a lot of time and energy trying to properly educate people against the myths, and you've heard them all. And we've been dealing with everything that the vaccine causes: infertility, to magnetizing us, to, you name it, we've heard it, and we've had to deal with it. And in all actuality, this is the safest vaccine that's ever been developed and deployed in a massive fashion like we have. And, and it's no longer experimental. So just trying to educate, first of all, clinicians and facilitate the ability for them to vaccinate and for them to educate their patients, because it became abundantly clear that the number one trusted source of healthcare information for patients is their physician. And so, we educated the public in a mass communication style as much as we could, but then we knew there were a lot of people that just were tone deaf to what we were saying. And so pivoting to physicians and providers became extremely effective in increasing our rate of vaccination. A little known success rate from Mississippi with this is, in the beginning, we were seeing our African American community being just inordinately impacted with a higher infection rate and higher death rate from COVID. And partnering with community leaders, we have been able to provide vaccination in the African American community at a rate higher than anywhere else in the nation. And now African Americans have one of the lower death rates among the demographics. So Asian Mississippians have the highest rate of vaccination, followed by African Americans, and then followed by Caucasians. And so that for us is a great success in helping our minority community get through this.
Thank you for that. Well, I think we're out of time, but I need to remind all the social workers here who want to, whether you're here or you're attending virtually, you need to put a code in to get your continuing education credit. I think the code's going to be on the screens. If it's not, let me tell you what it is. It's the number 5K run, the number 4, cancer. 5K run, 4 cancer. Y'all got it? Is it up? Well, I tell you what. If it's not, it's 5K, like a 5K run, then the number 4, cancer. All right, if you're attending in person, you'll need to turn your evaluation in at the social workers check-in table before you leave. If you're attending virtually, please complete the online evaluation. This evaluation has been mailed to you, and there will also be a link on the website. In order to receive credit, you need to submit your evaluations 24 hours from the end of this conference. Everyone else, you leave your check-in cards on the table, because that's how we're going to do a door prize selection in a minute. Restroom facilities are located right out this door on the south end of the room. If you'll go out those doors on this southwest corner of the room, you'll just go right across to the restrooms. If you need assistance, please speak to one of our volunteers. The next session will start at 10:45. We'll see you then. Thank y'all. Well, as we get started, I want to welcome you back and welcome the folks back who are watching virtually and participating virtually. It's time for just a really, really special part of this program. These folks that are sitting here with me are survivors. This is a very personal part of our program today. These are cancer survivors who are going to share their journey with you. And they're all going to take about 10 minutes. So as we start this, we're going to start with my friend, Devin Mosley down here. I've known Devin for a long, long time. And she's a 5-year breast cancer survivor, wife of 20 years to Ashley, and mom to Reese and Maddie. 2 cute kids. But anyway, she worked in nursing for a long time. She was a nurse educator, information technology for over 18 years. But she's currently a happy stay-at-home mom. And my notes say she has a small baking business, but I'm going to tell you she's got a great baking business. If you need something cooked, oh my gosh. Cinnamon rolls, muffins, good. So there's your little advertisement. She's got hobbies. She loves Pilates. She's an active member here at First Baptist Church. So Devin, thank you for joining us, and just tell us about your cancer journey, if you would.
Okay, I'm so glad to be here this morning. I've told others that I'm really, really comfortable writing about this journey. This is the first time I've actually spoken about it, so bear with me. I may get a little tearful, but I'm going to try hard not to. Cancer has kind of always been part of my story. I grew up with the knowledge that my maternal grandmother died of breast cancer in the 1950s when my mom was 16. So that was just always part of us. My mother was diagnosed, I'm not going to do this all the time, I promise, in 2015, and she had surgery and then chemo, and I called myself her care coordinator. She stayed with me a lot. I would take her to appointments, but then she would go home. I wasn't in the day-to-day, but I was arranging home health or appointments, all the things. So I very much understand the caregiver role. But then in 2016, I was sent for a baseline MRI. I just had my mammogram that was clean, and I was already being followed by a surgeon because of a little scare we had had. And he was like, oh, with your mom's diagnosis, now you can have an MRI. Insurance will pay for it. So I went in, not thinking a thing. A few weeks later, I got a call from my surgeon that, we found a little spot. It's probably nothing, but we've got to follow it up. He said, but I've got you an appointment for tomorrow to get a biopsy. And I should have been clued in right then, right? Most of us, if anything's scheduled for the next day, they pretty much know what's going on. So anyway, I give that information to say that was my miracle. If we like to think of the panel earlier was talking about modern medicine and the miracles of it. I shouldn't have had that MRI. My surgeon even mentioned it kind of like a light bulb moment at the end of our appointment. Oh, we can do this. Let's just go ahead and do this. Even after I saw the tumor, which was really, really small, thankfully, during the biopsy, I couldn't find it. I was 37 years old. A lot of insurance doesn't pay for a mammogram before you're 40. I was so thankful that we were able to catch this at that time. Because of helping my mom through her diagnosis and treatment, I was in the cancer game. And I'm a nurse, so I did have knowledge. I wasn't an oncology nurse, but it helped. So it was obviously traumatic, but the Lord had prepared me all along the way to not let it be devastating. My children were in 3rd and 5th grade at the time of my diagnosis, so you can imagine, just a lot of life going on. And I didn't know if I'd share this, but I think I will, because I probably will cry. But I remember one of the hardest parts of the very first, all that unknown, until you have information to do something with, you're just kind of in frozen mode. But when we finally had a little more information and we're telling the kids, it was after a rec football game that my husband had just flown back in from an appointment, not flown back in, driven by real quickly after one of my appointments to figure out what we were going to do, went and coached it, got home. Okay, then we're going to tell the kids Mom's got cancer. After they had just lived through Grandma having cancer, and it was really hard on her. But my third grade daughter just sort of, Mom, wait. So if you've got cancer and your mom had cancer and her mom had breast cancer, does that mean I'm going to get breast cancer? So every time I hear about the advances we have, I could look at her and say, oh, but baby, when my grandmother had it, we knew none of this information. I'm going to be okay. Grandma was okay. You know, by the time you may get cancer, but they're going to know what to do with it. And I could tell her that strongly. But it was such a unexpected moment. I thought, oh, she's not going to figure that out for a while. But anyway, just in case that hits someone in any part of your stories. I'm not using my note cards at all. I'm completely off track. So let's see. But I will say that taking care of my mom through cancer was honestly harder than going through the treatment myself. You can know with assurance what you're okay with for yourself. I'm tough. I could watching her and just being worried. What was this going to be? What does this look like? Do I need to drive and find all the things? That was harder. And then watching my husband take care of me was even harder. Because as Ron said earlier, you know, men are fixers. And I can remember shortly after he had shaved my head because he wanted to. And I was like, no, you can't. And he was like, no, we're going to do this. Actually, I let my children, once my hair started coming out, I just let them cut my hair. My daughter's third grade, you know, it's like, look, I know we've always said don't cut hair, go at it. So we sat in the backyard and she was like, are you kidding? And she just did. It ended up being such a precious, sweet moment in the midst of just a lot, right? But anyway, and then my husband shaved my head. And, but I remember after chemo, when I started to look sick, it was very hard on him. Even though he knew my prognosis never was bad. And I almost feel guilty saying that sometimes, but we were in a good spot, but we still went through cancer. And a comment I was going to say at the end, but I think Jimmy referred to this, you know, how the whole world starts talking to you about cancer and trying to make you feel better or what. Cancer is not a competition. Do y'all know what I mean? I mean, those of you, so you just have to kind of get out of that, like, block out the people when they're well, but you know, so-and-so, you're fine. Like, no, you have to understand where you are and take care of yourself and make choices based on what your professionals are telling you to do. So that's my soapbox on that part. But anyway, it was always very important for me to tell about my journey. It was just, the Lord just placed that on me. And I already had a little blog that I used every once in a while. So in real time, as I was processing, I wrote about what was happening to me. It was important for me that I didn't wait till it was done, because I didn't want anyone to be able to say, oh, well, of course, she knows everything turned out fine. Of course she can say this. I wanted to have it documented for myself later, what I was feeling and thinking. And I'm an open book, I guess. I know everyone is not as comfortable with that, but it was just laid on my heart to do it. And now, 5 years later, it is such a blessing for me to go back and read my own words. And it fortifies me, and it shows me what the Lord was doing in my life all through there. My testimony is written out. That's why I was like, how do I talk 10 minutes? I've got pages and pages of words to pull from. But so that's just a very important part. So just treatment-wise, I had surgery, I had chemo, relatively short term compared to what a lot of you are going through right now. But I did lose my hair. And as a redhead, even when you're a little bitty girl, everybody knows you from, oh, that little redhead, you know, I was known as my hair. And to lose it, I got okay with it. No one else was okay with it. I cannot tell you, oh, you're going to lose that hair. Don't, you know, we know, well, this room knows not to say that, but don't say things like that. But one of the most special moments in the journey, the day my hair started coming out, you know that tingly feeling, how you, for those of you, and it starts coming out, and I had that punch in the gut feeling, like, and the Lord just washed over me. He's like, Devin, I am your covering. And I thought, it may all be worth it for that, because I didn't have to have that. That, you know, it's prideful, it's vanity. Hair is just, but to know my precious Savior loved me enough and cared to let that be known and let that be noted in that moment was glorious, actually. And then I was okay. I wore a wig some. I don't know if I'm getting in the weeds here, but I didn't like it. I called it my dolly phase because it was just everything felt fake. And I don't color my hair. I mean, none of it felt right. It itched. I've got a kind of large head, so my wig itched. And but I wore it for other people because I just couldn't go to work and I had to talk about it all the time. I would talk about cancer, but I was like, we've got work to do too. Like, there's other things going on. But the minute I had just a smidge of hair, it was off. And I remember we had left Bible drill because, see, my kids were still little. One of the last competition, and it was April, and it was getting hot, you know. And I had that itchy wig on, and we were about to go to Moe's. I was like, kids, are y'all gonna freak out if I take this wig off and we go in there? And like, do it, Mom, let's go. And my husband, right. And so we marched into Moe's and got in that line with a bald mom. And I was okay. Not because I was okay, but because the Lord was He showed me that I was okay. Okay. So, but as you can already hear, I felt the Lord's presence with me pretty much through every step. When the diagnosis came, we were so weary from Mom's journey. And I mean, I sort of thought, I'm gonna have cancer at some point in my life. I just didn't expect it at 37. It's just sort of, but He just wrapped me back up immediately and never let me get to the pit. I know we all land in a pit sometimes, but the Lord just pulled me out before it could happen. It was like, I can't even explain it. And I mean, many of you probably understand that when people talk about the peace that passes understanding, it sounds trite until you've experienced it. And then you can't, there's no describing. I slept fine. I took care of my kids. We made it, and I was okay. Like, I feel like I was trying to help other people feel okay with what was going on in my life more than needing it the other way around for a time. But I'll tell you a scripture that the Lord placed on me, I think the day before I had my surgery. And He kept bringing me back to the image of wings. And so there's a lot of reference in the Psalms about being covered by the shelter of wings. But specifically, Psalm 61, 3 and 4 tells us, "For you have been a refuge for me, a tower of strength against the enemy. Let me take shelter in the refuge of your wings." And I just pictured going into surgery under the wings of my Heavenly Father. It's like, I'm going to be okay. It's going to be okay. So just some lessons. I don't know how long am I doing okay on time, Susan? Some lessons I learned through. Grace is for today. I heard it all my life. I knew this, but your grace is for today. We're not borrowing from tomorrow's. We're focused on today. Do what you can with the information that you have today. So any of you that are in the midst of treatment, don't go down the what if path. I'm sure if we took a show of hands right now, the what ifs, we all know that. But once you start it, your brain gets in that cycle and you will go into the pit. If you've had a test run, it's so hard, but until you know the answer to that test, you go by what you know today, and you keep living life. That was hard, but I had to just constantly circle back, like, this is what I know to be true right now. I'm not gonna sit in pity and think, but is this gonna come back in 5, 10, 15? Oh my goodness, am I gonna see my grandkid? No. You just said, stop that. Grace is for today. And God always provides that grace. I mean, He is faithful and true. What else was I going to say to y'all? And that also goes with energy. I found for those of you experiencing chemo, or that it was so funny, not funny, but energy with chemo is so different than energy, like fatigue from like the flu. If you're going through cycles of it, for me personally anyway, you would couldn't get out of the chair 1 hour, and the next, I'm good. So when you're good, do what you can. Go unload that dishwasher. Go for that walk. But it taught me to pay attention to myself in a different way, and pay attention to myself instead of just everybody around me. I came back to reading. I mean, it sounds like trivial, but I love to read, but I wouldn't make time for it. Now I read over 100 books a year. Like, I let myself do this because I'm worth it, and it's okay. It builds me back up. Okay, so do something that builds you back up, and don't feel bad about it. And I learned to accept help from other people. I'm sure we could all talk about and I learned, someone pointed out early on, don't take their joy away by not letting them help. Because I can do this, I can do this. I don't have to do this. People would come alongside and offer specific things, which is always the most important, to take the kids somewhere, to cut the yard. Oh my goodness, somebody just wanted to cut your grass. What a relief, right? And I had a friend that would put flowers on my doorstep every week or so. She never knocked on the door, she just put them out. And it might have been from her church's flower ministry, like taking the bouquets down. But that was the most special, loving thing. It just brought joy, like flowers. Okay. And I filled my minutes, didn't I? So I will leave you with, we were asked to leave with a message of hope. And the best way I know to do that is another scripture. Hebrews 10:23 says, let us hold fast the confession of our hope without wavering, for he who promised is faithful. Because I cannot point you to hope without pointing you to the one from whom my hope comes. And God does not waste details. Thank you.
Well, thank you, Devin. I want to introduce y'all to Katrina Myricks. And I'm already liking her better and better because this BOA thing, I know that is going to be cool. She is a resident of Madison along with her husband Ken and their daughter Caitlin. And she's got a 4-legged daughter named Coco. I'm hoping that's a dog and not just a bad. Okay, good. Fur baby, good deal. She's got degrees from Delta State University and Mississippi State University. Katrina recently retired from Holmes Community College after 30 years as an instructor in the Business Technology Department and as department chair. She is now a brand ambassador for Roden & Fields. She was crowned Mrs. Mississippi in 1992, maybe that's the BOA, and was a finalist in the national pageant. She's been in several area movies as well as documentaries. She's active as an advocate for breast cancer awareness as well as being an active member of New Hope Baptist Church. Katrina, welcome to the Hope Conference. Tell us your story.
I think we're still in the morning. Yes, I see 11:10. Good morning, everyone. I am extremely excited to be here, and I want you to know that we have a similar story with some details and a little bit different journey. It was in 2013 that I was called back to the doctor's office, and they told me I normally have my mammograms in December when I get out for the Christmas break as a teacher. So I had been for my regular mammogram in 2012, that December. And it just happened to be at the end of December when they called me back. They said, Katrina, we need for you to come back in for a quick second. And I said, quick second? And they said, well, a test, because we think it's a cyst pocket. We're just not sure, but we just want to come in to be safe. And I said, okay, when do you want to do this? And they said, tomorrow. I said, nope, flying out in the morning. I said, you know, it's almost New Year's, and I'm going to celebrate. So they said, okay, when can we schedule? I said, I promise you when I come back, I'll call. Well, I got back, I didn't call. And it's not that I wasn't trying not to, I just didn't think about it. So in January 2013, they called me and said, Katrina, you did not call us. And I sort of laughed about it, and I said, you know, I forgot about it. And they said, okay, can you come in next week? And I said, well, yeah, I can come. I'll make provisions. So guess what happened? It snowed. Remember the year in January, all that snow came? It snowed, and they called me that morning, and they said, are you still coming for your appointment? I said, yeah, is something wrong? And they said, well, the roads are, you know, sort of iced over. And I said, well, I guess I won't be coming. And I didn't go. And then all of a sudden, it hit me that that was 2 strikes. And for some odd reason, I just started thinking that night, you know, they have called you twice to come in and you have not gone. So the next week, I called and said, I need an appointment. And they said, okay, we can schedule you this afternoon. I said, I'm on my way. And I left and went. And actually, when I walked into the physician's office, one of the students there that checked me in, I mean, not one of the students, one of the individuals working was one of my students. So quick story short, I went in, and when she took me to the back, I saw the x-rays, and I said, ooh, someone has breast cancer, and they left their files up. And when the physician came in, we were talking because I had done the test and so forth, and I looked over and I said, someone's x-rays are over there, you've left them up, and whoever it is, they have breast cancer. And both that physician and the nurse looked at me, and I was like, okay, I guess they'll move it later. And then they started talking and so forth, and they told me I had breast cancer. And I said, no, that can't be possible because no one in my family has breast cancer. There is no history. Why am I always the first? And she said, Katrina, you have breast cancer. And I said, is that mine? She said, that's yours. And I went to my knees. And I'm thankful that God placed a physician in my life at that moment who went to her knees with me. And we started praying. And once we finished praying, we went through what we were going to do and our next step. And I left. And on the way home, I pulled in at, is it Smithville off of Lakeland? And I parked in that parking lot, and I just sat in my car and screamed. I'm going to tell you what I did. I sat in that car, I screamed, I hollered, and I said, okay, God, every time I get on a roll of doing something, something comes up. And I really sat there and said, I know I just told you I needed to lose some weight, but this was not my method of losing weight, being sick. And then I started to think about my husband because we had just buried his mother from cancer. She had just died from cancer. So that was May of 2012. We had just buried her. And I was like, well, how do I go home and tell him I have breast cancer? And then I started thinking about my daughter, who was 11 at the time, 11, 12. How do I tell her? Because I did not want her to think when you hear the word cancer, it meant death, because her grandmother had just died. And we were the care coordinators. I like that word. We were the care coordinators of my mother-in-law. So that became, you know, an issue for me. So I went 1 week without telling anybody. 1 week. And I was processing the fact that I had breast cancer. I was processing the fact that that phone was going to ring and they were going to tell me it was a mistake. I was trying to go through all of this. And then I decided to tell my husband. And he said, Katrina, you know it's probably a mistake. Let's get us a second opinion. I said, I've been back. It's not a mistake. I have breast cancer. And so we went through the process. He was dealing with that, and we were just talking about various things. And then I said, you know what? We're going to beat this. And he said, yes, we're going to beat this. So let me tell you what I did, ladies. I planned a photo shoot. We were going to have us a family photo. So we went in, had us a new family photo. My daughter wanted to know why was we having this family photo, and I said, because I want to have one, and her dad was like, just go along with your mother, because we had not told her. And so in my mind, I was like, if I die, when the new wife comes in, she gonna see what I look like. That was my philosophy behind that photo. I was trying to bring any type of enlightenment to me to help me get through this process that I could, and I'm not gonna lie to you, that was my train of thought. So the next night, we sat my daughter down to tell her. And she came to, when we went to tell her that we were getting ready to have surgery, I had breast cancer. Before we can say the word breast cancer, she said, Mom, you have breast cancer. And I said, Ken, why did you tell her? He said, I didn't tell her. And I said, Caitlin, who told you? She said, the papers have been on the table for about a week. And every day, every night, you and Dad come sit at the table. And so when I get off the bus, I've been coming in here flipping through these papers, and I found the one that circled said breast cancer. And my daughter left the room. She came back with this boa. I go around with this boa. It's had its days, as you can see, it's feathering. But she came back with this boa. She wrapped it around my neck. And she said, Mom, I know red is your favorite color because of your sorority, but God has given you a new color, which is pink. And he told me to tell you it's going to be okay. At that point, I'm going to tell you, I didn't think about cancer anymore. I had a different phrase because out of the mouths of babes, God has sent me an affirmation through this child. And in my mind, I looked at Ken and said, we just have to go through this because I'm going to come out on the other side. I already know. We called my mom right after that to tell her because I hadn't told her either. And I said, I need for you to come down in 2 days. I have surgery. She said, for what? I said, breast cancer. Girl, you don't have breast cancer. I said, come on down. I have breast cancer. So I'm really mothering my mother because she had a hard time with it. And the morning leaving for surgery, my husband could not get up that morning to go with me. He said, Katrina, I'm coming. Bear with me. I said, I'm okay. I said, I promise you, you just come when you can. My mother's sitting in the car, where's your husband? I said, he's coming. No, he's coming now. And when she left, I said, Lord, I need peace. Because if I don't have blood pressure calm before I get to the hospital, we will not be having surgery. I need for you to come in and give me peace. When my mother got back in the car and we left driving, on the radio came Yolanda Adams. This battle is not yours, it's the Lord's. And my mother went to say something, I did this number. And I said, we're not going to talk anymore. Let's take in what's on the radio. Following that, Donnie McKirkland, I can't think about it. I can't think of the song right now, but it was Donnie McKirkland. And when I was pulling up into the hospital garage, it was Praise Him. And when I walked into that hospital, I said, thank you, Lord, let's go through this. And I went through that, came out, and the next thing was my process. I'm just going to skip on over to the process. I had was scheduled for 8 chemos, 8 injections, 36 rounds of radiation. And when they told me chemo, the first thing I told Dr. Q, who was here on the stage, I said, am I going to lose my hair? He said, yes, you are, but you're going to be alive at the end. I said, okay, let's move on. And so I didn't think anything else about it. But after my first treatment, the nurse told me, said, you may lose your hair right after this treatment. I said, it can't be that fast. And she said, it could be. My hair was in 2 braids. I went into the restroom at home, went into the bathroom, started to take down my braids, and I saw something hit the floor. And I looked. I said, oh, that was a big strand of hair. And I did this number, and my hand was full of hair. So ladies, I'm telling you, the best advice that was given to me is that your hair don't come out like you think it's going to come out. I sat there on my floor just doing this, and I was just getting piles of hair, and I yelled for my mother. She came back there. She saw the hair, said, I'll be back, and guys, I looked up. My mother was gone. She called me later and said I couldn't deal with it. And I called 2 friends. The first friend said, the hair doesn't make who you are. It's just only an outer being. I said, okay. The second person I called said, girl, you got wigs. Go to your wig closet. We can take care of this. I said, okay. So when Ken came home, I had strags of hair. And he sat me down. He said, let's cut the rest of this off before Caitlin gets home. And we did. And he told Caitlin, Mom is now known as Q-Ball. And so they started calling me Q-Ball. The treatments wore me out. They wore me completely out. I will tell you, I wasn't sick, but I had no strength whatsoever. I slept day in, day out, would get up moving, but never could tell you what happened during those days. And on my 7th treatment, I got up that morning. Ken and Caitlin were in DC, and friends had times to come in to check on me. And I got up, and I stood, and I went to my knees. I dropped, and I was like, "What in the world?" And I had to crawl to the bathroom because I couldn't stand up. And when I got to the bathroom, I looked. My feet were just as black as the mask some of you have on. And so a friend called me, and they got me to the hospital. I had neuropathy. Don't know where that came from all of a sudden, but I had neuropathy, so I couldn't walk for about a week. And so they didn't do the last treatment because they didn't want the last treatment to bring in permanent neuropathy. So I told them, that's okay, God had me. I already knew because the child had told me that. So we finished the radiation, we went through all of that, and I'm just gonna tell you the best thing about my story and about this battle is that I have newfound friends called survivorship, and that we all went through the same journey as far as having cancer, but our journeys were different, but we've come out on the other end. And I wanna thank you for having me here today.
You know, before we started, I asked the Lord, I said, Lord, I've known Devin a long time. I don't want to start crying. I hadn't known you very long, Katrina, and you made me cry. But you made me laugh, too. Thank you. Thank you so much. Our final spotlight is on Nancy Smith. Nancy is the wife of Scott, 2 sons, Quentin and Oliver. She's a member of Centenary United Methodist Church, where she sings in the choir, serves on the church council. She's an 8-year lung cancer survivor. She's chaired the Relay for Life and Night of Hope in Macomb for the past 2 years. She's active in Longevity, the American Lung Association, and is a board member of the Mississippi Cancer Society. She works part-time for Southwest Mississippi Medical Center and is a member of the Hospital Foundation Board. She obtained her undergraduate and master's degrees in business and marketing from Mississippi State and was in Omaha to see her beloved Bulldogs bring home the national championship this past summer. But if that's too much Mississippi State, she told me both her sons go to the University of Mississippi up in Oxford. Nancy, share with us.
Well, thank y'all so much for asking me to be here. And this is not a sorority we asked to be in, but every time I meet a new sorority sister, it's a special day. So I loved hearing their stories. Mine were similar a little bit, but I think hearing lung cancer just scares you because it's still the #1 cancer killer of men and women. And even my breast cancer friend said, "Girl, that's bad." But she was there with me the whole journey. I was the mom that had a 5th and 6th grader when it started, and I did everything. I was the president of the PTA. I was in every organization, worked part-time. I didn't really have time for cancer. But, and the first thing I want to say is we have to listen to our body. And I did have symptoms. I was very tired, more than usual. I had that dry cough that just wouldn't go away. I had some shoulder pain. I thought it was due to an old wreck. And when I finally realized going up the stairs to my office one day, I was working for Southwest Community College. I was their primary fundraiser. I couldn't breathe. I was so out of breath. And I called my doctor, and he said, "Well, come in for an x-ray." And long story short, I started feeling bad in September, so this was in January. Thought I had pneumonia, gave me a round of antibiotics, and but he said, "I want you to come back in 2 weeks so we can repeat the x-ray." And lo and behold, I had a tumor the size of a lemon, and it was pressing on the left side. And so the way that tumor was pressing on my lung was what was causing the cough. But the interesting part of the story is the doctor that had to give me my news was my husband. And he's an ER physician in Macomb. And I know he's given devastating news to many, many people, but I could see the fear in his eyes that he had to tell me that. My diagnosis after that happened pretty fast because his best friend was a pulmonologist. And so Tuesday, I had a PET scan. I called my breast cancer friend. I said, "What do you wear to a PET scan?" And she said, "Don't wear anything with metal." So, okay, leggings and a t-shirt because I'm cold. So she told me what to wear. The next day, the doctor called me and he said, "Well, the good news is it hasn't spread, but you do have lung cancer and you got a pretty big sized tumor in your left lung." The next day, I had a biopsy and he said, "Your lung might collapse," and it did. And so we were sitting there. He said, "Well, we're going to have to observe you for hours." And I'm kind of bossy. And so I said, "Well, look, my son has a piano recital tonight. I'm not going home with the plumber. So either I'm going to walk out, but I'm not missing the piano recital." So he said, "Okay, we're going to let you go." And the next day, I had a diagnosis of adenocarcinoma, and my biomarker was KRAS. About 2 weeks later, we saw a surgeon, and I asked him one question after he and my husband had talked at length. I said, "Do you pray with your patients before you do surgery?" And he said, "Oh, Nancy," he said, "I'm going to pray with you right now." And in that little exam room, Dr. Mundinger and my husband Scott and myself had a little circle. And so the theme of all of us is faith and knowing the power of being around people who are going to build you up. I'm not going to go through all the whole process of chemo, but basically I had my left lobe removed. I had 4 rounds of chemo. I lost 40 pounds, lost my hair. I let my son shave my hair until I looked in the mirror and realized he had tried to put a Q in the back of my head. And I was like, I'm not walking around with a Q in my head. I got a wig. I got a blonde wig. I always heard blondes have more fun, so I tried that. I thought everything was good. The following October, I had a new spot. So I've done this twice. I did 4 more rounds of chemo, and then they finally removed my entire left lung. So I'm operating on one good lung. And one thing that I want to tell you that happened in between the 2 surgeries is one day, and we all hated to look sick, and I looked pretty sick. I had lost a lot of weight. I had a little skull cap on, and I went in my local Walmart. And at this point in my journey, I was thinking, I've lived such a healthy life. I've really tried to take care of myself. Why did this happen to me? And so I tried to think about things that I could do to control moving forward. And I realized that a lot of products are toxic. We live in a very toxic world, and I'm going to talk about that briefly in just a second. But I'm in Walmart, and I'm noticing this cute guy. He's kind of following me. And I was on an aisle, and he was on an aisle, and I moved on another aisle. And finally, I looked at him, and I said, "Can I help you?" And he said, "Are you okay?" And I said, "Well, no, you can probably look at me and tell I'm struggling and I'm getting ready to have another lung surgery." And he said, "I was walking out the door of our Macomb Walmart," and he said, "God told me to go and find you." He said, "It stopped me in my tracks." And he said, "I came back in to find you." And he said, 10 years ago, I needed a new kidney. And he went through his whole story, and he said, the chances of me finding a kidney were not good. And he said, sort of toward the end, when I was at the latter stages of being able to get this transplant, he said, I got a call and he was 10 years past that. He looked very healthy, and he said, I want to tell you that you're going to be okay. He said, that's what God told me. And I stood there on the soap aisle looking for some better toothpaste that didn't have parabens in it. And I always say I got cleansed on the soap aisle of Walmart in Macomb, Mississippi. And he said the sweetest prayer to me, and we prayed, and he left. I never knew his name. I think I was so overwhelmed that a stranger would do that for me. And he gave me that bit of hope I needed that day. So the first thing I want to say to you is be a stranger. Open a door, help somebody with their groceries, pay their bill in Chick-fil-A, whatever you can do to be a good stranger in this world we live in, be a stranger. I do try to detoxify my life now, and I can't walk down the soap aisle with all the washing powder stuff because having one lung, I have a lot of breathing issues, but I still walk and exercise and do everything with my family, but I just have to be careful. And so one question that I ask myself every day is what you're doing today going to build you up, or is it going to tear you down? Are the people you're spending time with this morning building you up? Absolutely. If you're in a situation and they're not, then minimize it or don't do it. I read more too. I do things that I enjoy, but ask yourself, is what I'm doing today going to build me up? Is what you're eating going to build you up? We talked about the antioxidants and the vitamins. Just eat a good salad. It's going to be blueberry season soon, and tomatoes and all that. Eat healthy when you can. That's not something you can do every day, but when you can. And so I just always ask myself, is how I'm spending my time, what I'm eating, what I'm doing, does it build me up? And if it doesn't, I say no. I say no. And you can reach the mountaintop for those of you who may be in the midst of treatment, or you may be taking care of somebody. All of us are a testament that you can get there. And my boys now volunteer with American Cancer Society on campus. And I know we're all here to be mentors for people who need a mentor, because there were people who were there for us. And last but not least, this is my motto: life is not measured by the number of breaths we take, but by those that take our breath away. I wish you all a great spring and great health, and just know that I love you. Thank you.
Man, kind of live. I think every one of us would like to thank them in a very significant way. And I think the most significant way we could thank them is, let's just do this. Let's everybody together say, God bless Nancy. Bless Nancy. Katrina, you're going to be a good preacher one day. Let's say, God bless Katrina. Bless Katrina. Thank you. God bless Devin. God bless Devin. Thank you. Ron Mumbauer, I believe you're going to come now. Are y'all going to stay up here? I don't think so. Susan's in charge. Is it all right if they come on down?
It's such a privilege for me to stand in front of you all today. Some ways I feel very inadequate because and yet at the same time, each one of us in this room has a story. In my profession, we call it a narrative. So I want you to just take a minute. We've had a great day, but I want you to take a minute and just breathe deeply. Take a deep breath and let it out slowly. Everybody, just breathe in and then breathe out slowly. Now do it one more time. Breathe in as deep as you can, fill up your diaphragm, and then let it out slowly. One of the things I've found in dealing with stress, loss, pain, grief, we don't breathe. We constrict. We tighten up. One other thing I want you to do as we talk about is I just have this opportunity just to try to bring some encouragement and hope. Look at the person next to you. Just look at him. Just look at him. No, really look at them. Keep your eye on them. So it's almost uncomfortable. I didn't say talk, but notice what happens. This is what community looks like. Keep looking at that person. That person that's next to you has a story, has a narrative that's different from yours. Each one of them is broken and are going through something today. Maybe good, maybe bad. So now you can talk. I want you to ask the person next to you, what is one thing, just one, because I'm going to break it. What's one thing what was one highlight that you have already gotten from today? Something was said, something was said, just real quickly. Talk to the person across from you or next to you. So make sure each person has said something. We're not going to monopolize the time. All right. See, what we have been talking about all day, and you look at the principle of hope, is community, connection, safety. Those are the guiding principles of health, of hope. Listen to the lady's stories here. Did you hear how many times somebody else, another person, a family member, even a physician, somebody was in their life? Hope. It's really a great word. But it's oftentimes overused in our world. I mean, think about it. How many times have you already said today, boy, I hope today's warm? Oh, I hope spring comes soon. You know, we're always hoping for something, right? So I went online. I know, we told you not to do that. I have 4 pages of acronyms for hope. 4 pages. I mean, so think about what that says to the world that we live in. So, hope. Having opportunity provides empowerment. Sounds good, doesn't it? Healing a person's exceptional. Helping other people eat. Helping other parents endure. Helping out people every day. Home ownership participation for everyone. That's what they call you for your extended warranty. Home ownership plus education. I mean, on and on and on. Because our world is constantly looking for hope. The definition for hope, and you've heard it over and over here today, a feeling of expectation. A feeling of expectation. A desire for a certain thing to happen. A desire for a certain thing to happen. To cherish. or a desire with anticipation. From a Christian standpoint, confident expectation of what God has promised, and its strength is in his faithfulness. A confident expectation of what God has promised. Synonyms that we go along with hope as aspiration, desire, aim, dream, longing, craving, good Mississippi word, hankering. So we throw all these words out to you, and as this message of hope is basically, what are you hankering for? What are you craving for? What is your anticipation? And what happens when we get into trauma, when we get into hurt and pain, we have a tendency to go so inward that we forget about possibilities. So I want to give you my best acronym for hope. Hang on to positive expectations. Hang on to positive expectations. You heard that in this whole day of just the optimism, the glass half full. Hang on to positive expectations. So I'll give you a list here real quickly. Some things that bring people hope. The dawning of a new day. When my first wife passed away, if you would have told me on December 11th, when I woke up that morning, that I would go to bed as a widower, I would have never believed you. She was sick, but she wasn't supposed to die. The one thing I've learned to appreciate in 17 years since she passed away is the fact that all we get is this moment, gone, this moment, gone, this moment, gone, this moment, gone. All of us woke up this morning and had a brand new day. All of a sudden, 24 hours were deposited into our account. Now, what are you going to do with it? Folks, you have this treasure in this, your hidden vessel, in this earthly vessel. You have learned to appreciate this moment, this day, because we're not guaranteed tomorrow. Not guaranteed it. But the fact of the dawning of a new day. We're into spring. Start planting flowers. Watch them bloom. Some of them are all, your Japanese magnolias are already starting to bloom, the red buds, and things like that. We're starting to see new life from the deadness of the last season. The world we live in is a constant season. So nature and gardening, plant a seed and watch it grow. What's the seed you've planted as a result of cancer, and what's growing as a result of it? I've watched, you heard these ladies, I have 4 sons. I've watched my sons since their mother died. In fact, his mother died in mine and my son. He was 16 at the time in his arms. And to watch that young man now having 3 children of his own and watching the seeds he's planting into their lives and into the lives of so many others. And that's what we get. Crisis is meant for growth. That seed has to push through that earth to come to its beauty. Some other things that bring hope. The pursuit of a passionate purpose. When we've been hit with unexpected tragedy, you have to find purpose, as well as its achievement that presents and provides a sense of meaning, finding meaning in the chaos. How about this one? Joyful and playful sounds and sights of children and people of all ages. My wife and I now have 9 grandchildren, all under the age of 8. You can pray for us later. But to watch their enjoyment of life. A child amazed by that. Don't forget to be a child. We get to be so adult and we're supposed to have it all figured out. We're still children growing Experience the best the world has to offer: music, art, beauty, dancing, singing, learning, creativity, innovation, and knowledge is all at our disposal, even in the midst of the crisis. Yeah, some days you don't feel like singing. Sometimes you sing off cue. Sometimes you just mouth the words, or you just listen to the radio. But it allows our different sides of our brain to incorporate the tragedy and the pain. History. Hope in history. I've done it before, so I know I can do it again. Today, just, talked about their hair. For me, every day is a bad hair day. Some days just aren't good. But tomorrow is another day. And the fact is if we get to live tomorrow, we get another day, we get another opportunity, or another moment. Hope, connections with proper, positive people, a higher power in the web of life. Laughter. A sense of progress toward a goal. Hope is a way of thinking that pushes us to action. One of my greatest movies, and my wife makes fun of me, but one of my favorite movies is It's a Wonderful Life. She said, "Why do you want to watch that same movie over and over and over and over again?" I don't know. But my favorite line in that movie is when Jimmy Stewart is standing there at looking at the raging water at the end of the movie, and he says, "I want to live. I want to live." Hope. Of course, he'd been through all that tragedy and all the crisis, but he was crying out, "I want to live. I want to make a difference." Folks, I'm here to say, you guys are the ones that are encouraging the world. Don't stop. Don't stop. You are a lighthouse. Yes, some days are bad. Some days don't feel good. You don't feel good. Some days it's just a bad hair day. But you are bringing hope to a world that really feels entitled and doesn't get it. But you're showing them the right way to live. 2 verses. I know everybody's given verses here today, but you look at the hope in Scripture, and in Hebrews 6:19, we hear that the author says, "We have this as a sure and steadfast anchor of the soul." Do you know that the anchor is the symbol of hope? The anchor of the soul, a hope that enters into the inner place behind the curtain. The curtain being the veil, and being where God is and where God resides. And then the other verse, again, out of Hebrews 11:1, says, "Now faith is the assurance of things hoped for, the convictions of things not seen." The conviction of things not seen. We see things differently once we've been exposed to tragedy and crisis. And if we begin realizing that, it makes a big difference. So now, one last thing. I started you on a little experiential journey. Take a minute now and write down a positive expectation you have right now. See, the problem is we stay so much in the crisis that we don't ever take time to celebrate and focus. So write down a positive expectation that you have for right now. For either today, for this week, for this moment. We only make the shots we take. If you aim at nothing, you hit it. So hang on to positive expectations. Hang on to positive expectations. That, my friends, is hope. Can I pray for you? Heavenly Father, these are your precious sons and daughters, your beloved sons and daughters in whom you find delight. You find delight in them. You created them. You breathed life into each of us in this room. Your word tells us that in this world, that in our distress, you too are distressed. And you promise to send the angel of your presence to walk with us through this time. So walk with these folks, your blessed, beloved children, as they hang on to positive expectations. We ask these things in the powerful name of Christ. Amen.
Thank you, Ron. There's a word of hope, and there is a song of hope, and Victoria Holmes is going to sing us a little bit about hope, I think, or give us some encouragement for hope through her beautiful voice.
As I lay me down, heaven hear me now. I'm lost without a cause, after giving it my all. Winter storms have come and darkened my sun. After all that I've been through, who on earth can I turn to? I look to you, I look to you. After all my strength is gone, in you I can be strong. I look to you. When melodies are gone, and you I hear a song, I look to you. About to lose my breath, there's no more fighting left, sinking to rise no more, searching for that open door. And every road that I've taken has led to my regret, and I don't know if I'm gonna make it. Nothing to do but lift my head. I look to you, I look to you. After all my strength is gone, in you I can be strong. I look to you, I look to you. And when melodies are gone, in you I hear a song. I look to you. My levees are broken, the walls have come tumbling down on me. The rain is falling, defeat is calling. I need you to set me free. Take me far away from the battle. I need you to shine on me. I look to you, I look to you. After all my strength is gone, In you I can be strong. I look to you. I look to you. And when melodies are gone, and you I hear a song, I look to you. I look to you. I look to you. Thank you.
Thank you, Victoria. I tell you what, Ron, your idea of looking at the people next to us and looking at them and really, really looking at them, it'd be good to apply that to that song and look at the Lord Christ that way too. Look to Him. All right, it's time for the presentation of the Hope Conference Lighting the Way Award, and this year's award is given in memory of Lori Spikes, who passed away from complications of COVID in 2020. Lori served on the Hope Conference Planning Committee for several years along with her husband, Jim. Jim Spikes is currently on the committee, and he is also on staff here at First Baptist Church. Lori was a registered nurse with over 40 years of experience and a longtime Southern Baptist International missionary, several places all over the world. Lori was also the inspiration, or is the inspiration, for the recently named Lori Spikes chapter of the Baptist Nursing Fellowship here at First Baptist Church. Lori's legacy was one of service, and it's an honor to present the award, Jim, to you this year. Jim Spikes. Isn't that beautiful?
Thank you so much. Those of you who knew her knew what kind of a special woman she was. And her family, her daughters and I, we thank you so much for this. It's been about now 15 and a half months and still pretty fresh. But I do rejoice in the fact that the Lord was able to give us 38 years together. And so thank you for this honor and just for remembering her and remembering us, and still covered your prayers as we continue this journey together, my family and I. So thank you so much.
Thank you, Jim. Indeed, a very, very special lady. Jim, you ain't half bad. All right, it's time for everybody's favorite thing, the door prizes. And our queen of door prizes, Jean Clark, is coming up here to make this. You're not going to come do this, Jean? All right. Well, look, I'm just going to get out of the way. After our door prizes and closing statements, don't forget to pick up your to-go snack lunch provided by MSDH/MPC3. I hope you know who to thank for that, because that's a lot of initials. But if you pre-registered for this event online, then you mail your form in. Now, Sam.
Yes. Well, we, first of all, just thank you so much. It's been a great morning, and I think things went so well. We appreciate all those that were involved, but we especially appreciate all of you for sharing this time with us. We're delighted to be able to give out some door prizes, and so we're going to go ahead and start that right now. You'll bring them up. Some are going to be presented by the vendor, and then I will announce some.
Hi, my name is Paige Lewis, and I work for Home Care Hospice, which is a Mississippi-owned and Mississippi-operated hospice company. And we have 2 door prizes for you this morning. The first one goes to Miss Carolyn Miller.
If you raise your hand,
Okay, and the second one goes to Miss Taisha Reed. Thank you so much for allowing us to be with you today. I've certainly enjoyed it.
If your name is called, if you would just get our attention, we'll bring that gift to you. And if you happen to have already left, sorry, we're going to draw another name.
Good afternoon, everyone. My name is Deshandra Barnes. I work for the Mississippi Partnership for Comprehensive Cancer Control Program. And our first winner is Rochelle McClain. And our second is Denise. I'm sorry, I'm not going to pronounce this correctly. Isom. Okay.
Back there. Okay.
Go ahead and do that.
Sure.
And then Pat Mounds.
Do we see?
Pat Mounds.
Pat Mounds? She's right there. Oh, okay. Great.
And lastly, it is Dina Reese.
Dina Reese? Okay. Good. Hey.
Hi, everyone. My name is Tiara Love, and I'm the Patient Research Manager at the UMC's Cancer Institute. And I have a door prize for Vera Kelly.
Vera Kelly? Still here?
Okay, we'll try again.
Okay.
I have a gift here from the Mississippi Department of Health Breast and Cervical Cancer Program, and that is Hazel Watson.
Okay, right there. And here we go. We can.
Helen Williams.
Oh,
All right,
okay.
I'll take
Good deal. Okay, here we go. Some more.
Good morning, everyone. It's a blessing to be here with you. My name is Rochelle Thompson. I'm with the American Lung Association, and I have several prizes to give away this morning. The first one is going to Jimmy Scott. The next one is to Gwendolyn Santos. Okay. Yeah, please. Thank you. And this one is going to Claire Hubbard. Claire Hubbard. And this next one is going to Patricia Williams. And Patricia Williams is a long time. I worked with her many, many years ago. It's great to see her today. And we was talking about getting contact information. So Patricia, I'm going to take your tag. I'm going to take your tag right off of here. So I got your contact information. And I do need to make a quick announcement. The American Lung Association is currently seeking individuals who are interested in getting involved in advocacy efforts on lung cancer. We have a specific opportunity next month for individuals impacted by lung cancer, so that means you can be a patient or a caregiver, to advocate for lung cancer research funding across access to health at the federal level as a lung force hero. Currently, we do not have a lung force hero here in Mississippi. We have them for all 50 states, and we do want Mississippi to be represented. So if you're interested in becoming a lung force hero, please give me a call at 601-832. So I know everybody got pens. I know you may know someone. So write my number down and call me, 601-832-9112. Again, Mississippi needs a lung force hero. And also, too, I left some flyers on the table, these about the Lung Force Turquoise Takeover. Put that in your bag. And when you get home and you get ready to read all of the wonderful information that's in your bag, right, from all of these organizations that could be your support, they could be some nuggets that could help you on your journey. So make sure when you get home, take all of that information out your bag and read it. I want you to read about the Lung Force Takeover too, and help us if you can. Thank you.
Great. Thank you very much. We'll keep going here. Okay.
Okay, this gift is from the Awaken Cancer Support Group of Broadmoor Baptist Church, and it is Lakeisha Williams.
Okay. Got several more.
Okay, this one is from St. Dominic Gift Shop, and it is Melinda, can you read that?
Atkins, maybe? Melinda?
Melinda.
Okay.
This one is from Summit Counseling, and it is Dominica Ramsey.
Okay. Over here.
Okay, this one is from Central Mississippi Planning and Development, Wilma Butler.
Got it? Okay.
And lastly, Arthur James Jefferson.
We see. Okay.
Okay, this one is from St. Dominic Gift Shop, Florence Wilson.
Okay.
And Waterford on Highland Colony, James Kelly. Mr. Kelly?
Oh, back there.
Okay, he's back there. Salad Station on the corner of Lakeland and Airport Road. $25 gift card, Cleo Pig.
Right.
Okay. What?
No, that's good.
Oh, I took your job, Mr.
No,
Sam.
you did.
Okay, this is from Baptist Cancer Center. Dewana Cheerless Young.
Duana?
Yes, she's up at the
Okay. All right.
Okay. Mr. Sam, I have to get a picture with you.
I'm going to give this one away because I think it's a biggie. It's a 3-month membership for a family of 2 at the club at St. Dominic Hospital. And there's no enrollment fee with this either. It's completely free. 3 months. And it is Patsy Johnson. Patsy Johnson. Oh, Patsy doesn't want this. Okay, so we need to draw another one. Patsy Johnson's not here, okay? Patricia Ann Willis. Oh, wonderful. And thank y'all for writing so perfectly, too, where we could read it.
Okay.
I need to pull one more name.
Oh, okay. Absolutely.
Don't make me pull.
Barbara Brown.
Barbara Brown? All right.
Okay. Okay. Is that all? Okay. That's it.
Thank you, Sam. Thank you, ladies. Thank you all. Thank y'all for being here. Thanks to all the folks who provided these prizes. Every one of you are important, and we thank you for being here. And I know it's time to go to the house, so let's just do a tiny bit of housekeeping, and then we'll let you go on home. We hope to have this year's conference archived on the website in the near future. It's hopeconferencejackson.com. hopeconferencejackson.com. Also, you can check that website for cancer resources in the area and other related events held throughout the year. Remember to fill out and leave your evaluations on your table, and social workers complete your checkout process. If you pre-registered for this event, do not forget to pick up your to-go snack lunches. And look, have a great afternoon. You're dismissed. Thanks for being here.